is starting. We're resuming the meeting. So as we did before, I'll invite those of you who would like to carry on chatting to do that outside. Otherwise, please go back to your seats as we are eager to start. And we are going to start this afternoon with a speaker coming from what we thought would be like a colder country than here, but we were probably colder than you guys a couple of weeks ago, and it's probably like hotter those days, but you know, climate change and all the rest. But Tina is coming from Copenhagen, Denmark, and from Lundbeck headquarters to tell us about, so I'm reading the official title, Advances from Denmark on Public-Private Partnerships and Brain Plans. So Tina, we're really eager and looking forward to your presentations. And we are probably now moving from the wildlife and nature-based narrative into like more sailing and lighthouse-based conversations. So over to you, Tina.
Not a lot of sailing, but a lot of lighthouse. Yeah, so ladies and gentlemen, first of all, thank you so much for having invited me. Exciting to be here today. And as Fred alluded to, this part, my little part of the session, will talk about advances from Denmark. More specifically, I'm going to speak about the work of improving health in the context of public-private partnerships, multi-stakeholder partnerships. And here I'm going to present a concrete case called the Lighthouse Life Science. I've had the privilege to present the Lighthouse concept in different international settings, including some arranged by our host here today. And I hope it'll always also be of interest to you. At the end, I'll briefly speak to the Danish Brain Health Plan Initiative, which is another advancement from Denmark. The Lighthouse Life Science is a possible new way of addressing one of the fundamental challenges we see in healthcare now. So there's not enough resources and there's not enough capacity. With a changed demography, with an aging population, with an increase in chronic diseases, and with a general focus on health conditions, the healthcare sector, not only in Denmark, but in many countries we can see across the world, are under huge pressure. And therefore, there's an urgent need to find new ways of addressing these challenges. And this is exactly what the Danish Lighthouse Life Science is aiming for. It was launched 2 years ago by the Ministry of Industry in order to ensure welfare and growth in the wake of COVID-19. It's a cross-cutting political initiative, and it's supported by 5 Danish ministries, including also the Ministry of Health. And the Lighthouse builds on a strong Danish tradition of public-private partnerships. And it's created in the field of life science, which is also a Danish stronghold. And it now includes more than 300 partners, and you can count everything from small startups, public institutions, pension funds, foundations, academia, and private organizations. And all sharing the twofold aim to improve health and to ensure growth, while providing inspiration for new innovative technology solutions. In the first phase of the Lighthouse, it was chaired by Novo Nordisk, another Danish pharmaceutical company, chaired by them and had its focus on healthy weight. Last summer, the focus changed to mental health, and Lundbeck took over the chairing the Lighthouse. And choosing to have mental health as the new topic area is a way of also recognizing the complexities of mental disorders and psychiatry that requires innovative solutions beyond capacity of the public system. So over the next 3 years, the Lighthouse will focus on mental health. And after this, and with the experience we built, we will move into another chronic disease area where we can move forward. And here Lundbeck will leave the lead to someone else, but we have the next 3 years. Already now we have experienced what can be fostered with the Lighthouse as the Lighthouse Life Science. So one thing is that we develop innovative solutions utilizing new technologies and solutions and knowledge. And that can be app solutions, it can be VR technologies, and so on and so forth, that can guide the user and collect data, that can be the hands that there are not enough of, all in order to help treat and improve lives for the people. We also develop and implement solutions in collaboration with patients, and at the same time, developing competencies both with the private and the public partners we are working with in innovative business models, because this is a new way of working. We build on evidence through systematic data collection and value creation. We need to prove what we are doing. And not least, we support national strategies and political priorities through prevention, identification, and treatment of the chronic diseases we are working with. So in Denmark, we've come to an understanding that the public sector cannot address healthcare challenges on its own. This happened years ago, and has paved the way for the private sector within specific disease areas. With the Lighthouse Life Science, we've taken another step forward in the public-private collaboration. And as such, the Lighthouse explores what a shared responsibility across public and private sectors to find innovative solutions to enhance healthcare challenges can bring. You may ask why a pharmaceutical company like Lundbeck engages in a lighthouse on mental health. So our history goes more than 100 years back, and we've always been focusing on the brain. And of course, that means to discover, develop, and bring medicines to people living with psychiatric and neurological disorders. But we see the Lighthouse as an opportunity to also show our commitment to not only help patients with their treatments, but also to show that together we can find innovative solutions that will have a societal impact at the end of the day. And the hope of the Lighthouse is to make Denmark an example of innovative health and welfare technology solutions, focusing particularly on utilizing existing models of public-private partnerships and developing new collaborative approaches to address challenges across various chronic diseases, but starting with mental health here. As mentioned before, the evidence-based decision-making is one of the guiding principles we are following, and the Lighthouse systematically collects data and value from the different pilot projects we are running. Additionally, the collaboration model is designed to address real healthcare challenges, and it's aligned with national strategies in Denmark and supporting political priorities. And that's hugely important when working with this, that there's a buy-in from politicians. A perspective that inspires many is the synergy between business and health policies, which is mutually dependent. And successfully creating healthcare solution often carries commercial potential that benefits growth and employment, leading to win-win situations where citizens and healthcare and business and society as a whole get the reward. From one important Danish initiative to another. So in Denmark, we've also worked on a brain plan inspired by the WHO IGAP and inspired by some of the other countries we also heard about earlier today. So only last year, a number of stakeholders from medical societies, organization, hospital management, and not least patient associations gathered in the belief across neurology and psychiatry, gathered joined forces to prepare recommendations on how Denmark can strengthen our efforts in the field of brain health. And together, this group of representatives from 17 societies, organizations, and groups have signed a recommendation call, a letter of intent, you could call it, that emphasizes the need of improving brain health in Denmark, to improve and ensure a holistic approach and understanding to how we solve what we are looking into. And also pointing out that resources and knowledge is how that can be used in the best possible way. And it requires new solutions and new ways of thinking. So we spent last year getting this together, and 2024 will now be the year where we make politicians and policymakers aware of this, promote, position the letter of intent, and hope to be able to influence in order to have a brain plan in place a little later. And I know that the brain plans is also a topic in a panel debate a little later, so we'll hear much more about that. So in conclusion, let's remember that prioritizing mental health or other chronic diseases in the context of public-private partnerships or brain plans in the context of, with brain health as a focus area, it's not just about individual well-being, it's also an imperative for building healthy societies and have an impact in society as well. Thank you.
Thanks a lot, Tina. Don't take it out immediately. I just have one follow-up question, because I was impressed and it resonated to a discussion I had over lunch with George and Kenna and other colleagues. You said 5 ministries are standing behind this. That's quite impressive.
Yes.
Because what we realized, an issue that we need to address is the fragmentation at policy level. How did you manage to get 5 ministries to agree on that program and the need to create the Lighthouse Life Science program? And how long did it take?
So, so I think it really came out of out of COVID. So there was a requirement to see how the government could boost back energy in society, and that was with the business focus, right? So how could they boost back energy growth and employment in the country? At the same time, there was this looking into the healthcare challenges and building on 2 legs. So on the health and on the industry, they also invited the research, the employment to be part of this. So that's, I think it came from government side that this was actually set up and then move forward. And it was not until later that pharma was invited to the table. So it came out of that.
So it's a fantastic example of a success in terms of public-private partnership, but no, you were telling me last night that you were in the process of recruiting those startups and other players. What is basically the timeline for delivery of their results?
Yeah, so we spent the first half year since we started to go over on mental health last summer in preparing. And what we do have in Denmark is a psychiatry plan, a 10-year psychiatry plan with, as a political priority, with a lot of political funding, public funding behind. So we started looking into that and how we could not reinvent the wheel in order to go and find new innovative solution that we kind of looked for ourselves, but linked it into the psychiatry plan, because there's a lot of work behind that. It's a very cohesive piece of work. And we tapped into that, and we've actually collaborated with the Danish Health Agency on this. Usually they would have arm's length to pharma companies like us. There's a public-private setup here. But because we are in the public-private partnership, there's an openness and a more transparent way of looking at this. So we all got together around the table and looked into the priorities we're going to work with. And the first things we are going to look into how children and adolescents miss thriving in schools. So that's one of the first projects we're going to look into, and also the challenges in workplaces. So those are the 2 first ones. The third one will be severe psychiatry that we will look at a little later. Now, all the invitations, the advertising for the pilots to come in has gone out now, is going out these days. And we have what we call a growth platform, where all companies, all startups, everyone who wants to look into this can come, and they can be given advice, and then can be given insights in the different aspects, because there are a lot of aspects. One thing is understand the challenges we're trying to solve or address. Another thing is that we need the component of evidence. We need to build in evidence in what we are doing, because we need to track what we are doing in order to prove that this is worth doing. So over the next half year, this is what will happen on the growth platform, and then the real pilots will be kickstarted summer this year. And then we have kind of milestones along the way. So if they do not prove after, for instance, 6 months, if they do not prove that there's evidence behind what they're doing, they will be closed down and money will be channeled to other.
So it's basically Denmark's Innovations Got Talent, something like that. Just a last question, but it really to pave the way to the panel that is going to come now. You said that you would first prioritize mental health because it's linking to the psychiatric plan in Denmark. What is the extent? Oh, you said that there was a resonance in the policy arena, if I understood correctly.
Yeah.
The question I wanted to ask is, what is the potential in your view for the brain health plan that you anticipate to become a driver of the Lighthouse Life Science in the future for brain health after mental health?
Well, I think what the third topic theme will be in the Lighthouse is not even considered yet. We have enough on the mental health agenda, but brain health is also a chronic disease, so that could be possible.
Yeah. Okay. Yeah. Okay. But looking forward to hearing more about the success of the talents that you will identify. Okay.
Thanks.
Thank you very much, Nia.
Thank you.
Okay. And I'd like now to invite our colleague and friend Pavel Svoboda to moderate the panel to come. So, Pavel, you have multiple hats, but on the program you were only, I would say only, if I can put it that way, identified as a founder of Neurocentury. But I guess you don't need any introduction, Aka, other colleagues having put this event together. So over to you to moderate the panel to come. Thank you.
Super. Thank you so much, Fred. And I would very much like to invite the panelists, those who are here, to join me on stage. And we will have also a couple of online interventions. So this panel very much follows on what Tina has just with regards to the plans for the Danish initiative in this area. We will examine what next generation brain plans should be all about. And I put emphasis on next generation. I think that's where the attention needs to be focused in the next 40 minutes. So brain plans have been completely unique in that sense that they have analyzed the needs and they have put forward a very comprehensive plan of action. And they have also largely been bottom-up, even though sometimes in some countries with a top-down element. But I would like to look a little bit into that as well, meaning, is it good enough to have bottom-up? It's a huge value in itself, of course, but we have so much that depends on governments, on policy, on regulation, on funding. So what's the best moment in time to bring the two sides of the equation together? So my questions to the panelists will be twofold. First of all, looking into your individual crystal balls at next generation brain plans, what is it that we should be thinking about? What lessons learned from the first set of brain plans should we extract? And secondly, and this came up early in the morning, like what's the space for mutual learning across Europe and beyond? Everyone is doing very useful things. We have already learned a lot today, but do we need some sort of structured space in order for this mutual learning to be better organized? So I would like to start with Henrik Persson, Secretary General of the Norwegian Brain Council. If Henrik is online, he is, because obviously, sequentially, Norway was the first in formulating the brain plan. And you are now working on your second brain health strategy for the subsequent period. So Henrik, if you could tell us what lessons from the first brain plan have you learned, which you are now putting to action when you are designing the second brain health strategy?
Thank you very much, and thank you for inviting me to this panel today. It has been a very exciting day and meaningful, and I've learned a lot already. You are asking me a quite large question, but I will try to answer it more shortly or consistent. Because we've been working on the Norwegian Brain Plan for the last 5 years, the existing one, and of course we have learned a lot. But I think the lack of concrete measures in a plan is a challenge for me to be able to say what we have of measurable results. So I think that is one of the things I would like to address as a point for the next strategy, that we need to have, of course, some overall goals for the or objectives for the plan, but we also need more concrete measures so that we know what type of actions we are going to target and prioritize. I will say that one of the main things that we have gotten out of today's national brain health strategy is the foundation or the basement for cooperating with the health authorities. Because through this plan, we have gotten, first of all, a better understanding of brain health as a concept within the health authorities. But we have also established, or they have established, a really useful partnership within the health directorate for following up the strategy. So this means that we have the opportunity to meet with the health authorities several times each year and continuously in contact with them and discussing what kind of challenges and possibilities we have on the field. So I will say also to your question about building bottom up or top bottom. I think one of the key elements for success in Norway is that the brain health strategy itself is rooted in political in the political environment. So this is not a plan that we as organizations have made ourselves and served to the Norwegian health authorities, but this is actually a plan that the health authorities themselves has been making with, of course, help from us. So I think that is a good place to start.
Super, thank you so much, Henrik. This was extremely useful, and I would like to go now to Peter Falkay, who has spoken before, and he already emphasized the comprehensive nature of the German brain plan that looked both at what is on the minds of the neurological and psychiatric community. So Peter, with that in mind, what are your lessons learned for the next phase in the implementation of the German brain plan?
Well, thank you for inviting me. Well, I would say the first thing you learn to put together a brain plan to start with is quite difficult. But the next step, which is even more difficult, to get funding. So you have a nice brain plan, and it took you maybe 1 or 2 years to put that together. And then you go to your federal government, and they clap you on the shoulder and say, "Oh, well done. And by the way, we have no money." So that's my first lesson learned, because I had this delusional ideation that I thought, well, if I have a plan, I will get money for that. So what we did in the second phase, and I think that would be my sort of advice from that, we have broken it down into sub-programs. So I'm leading now one on the prevention of depression. And as was pointed out by the previous speaker, measurable. So what we do is really, what can we achieve in order to prevent or ameliorate the cause of depression? And along these lines, what I learned, it's much easier to get money for that. And coming to your second question, bottom up or top down, I think the way I look at the moment, I think we need to go top down for a few more years in order to implement programs. And then I think a lot will be sucked up from the communities.
Super, thank you so much. And I will want to come back to that question of bottom up, top down, also as we look at the right sequence of events shortly. But let me go now to Azad Boni, who is the Global Head of Neuroscience and Rare Diseases at Roche. And my question to you would be, first of all, how would you see industry involvement in the brain plans, both in existing ones and the ones to potentially, I mean, what would be the ideal type of engagement that you would seek through this channel with the community?
Well, I think I would have to learn more about it. First of all, thanks for including me on this panel and at this conference. The way we approach the things, of course, from industry is very much focused on, in terms of thinking about brain health, on disorders of the brain. And what we're doing in the unit that I'm at, in research and development, early development, we're focused on addressing these fundamental questions and providing, hopefully, ultimately, transformational treatments for people with neurological and psychiatric disorders. So we're very excited about all of the sort of, in the last couple of decades, I think there's really, it's all a matter of timing. And so right now is the time to be in neuroscience, and in particular in neuroscience therapeutics, because of all of the advances in human genetics, in our understanding of disease biology, and the technologies that are being developed. Ultimately, this will lead to treatments. We're already seeing this. If you look at Roche history, going back to the 60s, up until, say, 2017, within Roche, you would see, in terms of a class of treatments, once every decade or 2 decades, so quite sparse. However, and that reflects what it was like, which was extremely challenging. However, since 2017, within Roche, there have been 4 launches. And so I think that's a pattern that will accelerate. So we're really on the cusp of major discoveries. Now, fast forward to the launches, of course, we will need to be extremely collaborative with the rest of all of the other parts of society to be able to bring these treatments to patients. And that includes, obviously, the healthcare systems, governments, and private entities. So I think that industry can play an important role in collaborating on these plans that you're putting into place. And obviously, we're starting from the point of view of disorders, but ultimately, we have to think about also enhancing brain health. And so I think I'm very excited to be here and to learn more about this, but I think there is a role for industry to play as a partner in this. In previous life, I was in academia and have had a lab. And there, it was very clear to me that we needed to have a lot of collaboration as well, in particular with government. And actually lobbying on behalf of, for example, Society of Neuroscience in the United States, to appeal to both sides of the aisle, the political aisle, as to why neuroscience and brain health, per se, why these are so important to society. So I'm very excited, again, to learn more about this.
Super, thank you so much. It made me think what can be realistically expected from brain plans, because by definition they need to be comprehensive exercises where you build a consensus view across the community, and also with the funders, the payers, and so on, the regulators. And as industry, I mean, you have various other channels, right, to express your point of view. You have different industry bodies that represent you. So I'm curious, how would you sort of see your list of priorities for this exercise? You don't have to answer now. Maybe I go to Marco and give you a moment to think about this. So Marco is a well-known mental health and health technology investor and advisor with ample experience also in pharma. And Marco, I mean, my basic question is, what's there for the investment and finance side of the equation in brain plants, and how should that community be brought on board?
Yeah. So I think if we think about so first of all, thank you and good afternoon, everyone. I believe that the stage has been set. Okay, so the first phase was to define brain capital, define brain health, clarify why it is important to invest in it, and how does it break down. I still believe that it's quite holistic, or a bit too holistic. I mean, it has to be holistic by definition, because everything influences brain health and brain skills, and from the environment to all the things that are well known. But from an investor or an entrepreneurial standpoint, you need to break this down. You need to really explain, what are the priorities, and I think we need to leave that a little bit to market forces as well. But we need to create the framework conditions for investors to come to the party. Okay, so today I don't know how many investors we have in the room or how many entrepreneurs we have in the room. I don't know, how many industry players. We have some industry players here, but I think the next stage for me is to create a plan, or not a plan, a framework for investors to meet entrepreneurs, for them to be exposed to the policy priorities. Policy priorities are framework conditions, but then you have to somehow create the incentives and leave the market to play out, okay? And naturally, you'll see a lot of investment gravitating to the areas of greatest potential, right? So I don't think we can necessarily steer it top down. We can create, let's say, the framework conditions, but we should then allow, the entrepreneurs to come forward and stimulate entrepreneurship. So if I ask, if you want to bring the entrepreneurs to the party, just invite them to the party, right? Invite them to voice their opinion, patients, but also entrepreneurs. I mean, I believe that we will, probably gain a lot from seeing what entrepreneurs can achieve and be surprised. But a lot of capital, unfortunately, is not going there at the moment because, all sorts of reasons. I mean, we know neuroscience has been underfunded for. Pharma has been pulling out for 20 years. Now it's coming back a little bit. Actually, this year, I think there's a bit of tailwind, so this is great to see. But for 20 years, there has been very little pharmacological interventions or innovation, right? And the reason for that is because it's very hard to do trials in this space, because there are other areas that are a little bit easier. They have harder endpoints, and pharma wants some degree of certainty and return on investment. So I guess it's thankfully the tide is turning and we see more money coming into the space again. But let's let's ride that wave. Let's put a little bit more fuel on that and get there. And it's, by the way, pharma and therapeutic interventions are great, but I think there's innovation across the healthcare continuum that needs to happen. So in the way mental health is services or brain health technologies are accessed, delivered. I mean, there's so much to do, and there's so much innovation that we need across the healthcare spectrum. So I mean, by the way, I am also doing that. I'm putting myself forward, and I want to talk. If anyone wants to talk to about this, I mean, I'm convening, the most active venture capitalists in Europe and some US investors as well, and identifying 30 or 40 of the most promising startups and scale-up companies in this space, brain and mental health, in Lisbon on the 2nd and the 3rd of May. I'm shamelessly promoting that investment event, but it's an opportunity to bring, and I would like to invite you all to come and be part of it and see what investors are interested in and see what entrepreneurs are working on. And so maybe we can build a bridge between the two worlds, policy and investment world and entrepreneurship.
Okay, but you would see the brain plans as useful in this journey.
It's as I said, it's the next stage, right? The next stage is you ground it a little bit and make it more tangible for investors as to what is that we can do.
Azad, so if I could come back to you about this sort of priority selection for the brain plans, because I mean, surely we cannot cover everything that matters in this space. So from your perspective, I mean, what should an ideal impactful brain plan be focused upon? We had a great overview from Claudio Bassetti this morning of the Swiss brain plan, which is, I would say, the latest that is on the table. Focus on awareness raising, on training and education, things like that. So what would you see as the most impactful priorities for a brain plan?
Well, of course, everything ultimately is important from the perspective of industry and Roche per se. I do want to say, by the way, in terms of Roche, we have been committed. I'm proud to say that we have been committed to neuroscience, even during tough times. And actually, that goes back to the over 125-year history of the company. The neuro is always part of it. And in the 60s, actually, neuroscience made Roche the #1 company. And so I would say in the decades that followed, when things were really tough, it's really good to see that actually our companies remained committed. So from industry perspective and from Roche perspective, and there are many people who can speak to this, we have interest, obviously, in patients. We want to do, it's in our statement of purpose. We are doing everything we can now so that we can address the needs of patients. And so that, there's a value chain of this. And if you look at this, there are actually collaborations in the different parts of the value chain, from research all the way to access, with the sort of counterparts outside of industry. And so what I can say from the research and early development perspective, we have a lot of collaborations, for example. And I'm looking at Simona because I know in terms of on the other side of it, actually there have been collaborations with academic units that have been very important to kind of highlight, the burden of neurological disorders of the brain on society beyond patients and families, but also on healthcare systems and beyond. On the research side, we have had a number of collaborations, actually significant ones. For example, the Roche Genentech group has had collaborations with the UCSF Weill NeuroHub to essentially address questions that are important at a science level, that are ultimately important for the brain. Here in Europe, this is part of a larger effort. You could say it's a sort of a, you have to start somewhere. We have collaborations with the ETH for postdoctoral programs. So I think that, there are a lot of things that are going on. We are definitely attuned to that, these disorders, including in the nervous system, take more than just, one player. So we're very eager to play our role.
Great, perfect. I will open up for questions and comments. So please signal to me if you would like to speak. This will happen momentarily. I understand that Marcel is not joining us online, right? Because I can't see him. So he was going to speak more about the Swiss experience, but he was supposed to be here, but clearly he is not in the room, right? Just checking. Okay, good. So we will continue with my second round, which is about how we can learn from each other and consolidate this effort. And after that, I will open up for questions and comments. So again, there has been this first wave of brain plans. We are thinking of the next wave. The European Brain Council does a splendid job now documenting and reviewing what's going on. You can find all the brain plans on the EBC's website. But then again, how does the dialogue between the different stakeholders who are active in the different countries, how is that organized? And especially in the context of the new European policy cycle, I think it's a relevant question, because we are in right now, as we speak, in this extremely programmatic period for the next 5 years. I think this is unprecedented in sort of global setting, how much policy ideation goes on before each EU cycle. So it's also an opportunity to have an imprint. I have put together a few ideas. If you're interested, I have a few copies to share, including an idea of a consolidated brain plan. So basically a structured way of developing this conversation, which basically should be done, in my view, by virtue of European Commission asking every country to draft a brain plan and then develop some sort of frame of comparison so that it's not apples and pears, but we have, there will be differences, and there have to be differences because the national specificities are different, but we need to have some sort of framework of comparison. So my question to everyone, starting with maybe Peter now, would be, how would you conceptualize this type of interaction between the different national communities so as to make the most out of it? You spoke about the eagerness to also see results in terms of funding. So how should the community's voice be strengthened for that to happen?
Well, I think that EBC has an important role here. I mean, you have outlined Claudio's talk, and I think I think that the Swiss Brain Plan is it's not only new, but it has new input, so kind of a role model. So I'm always looking at that. So I personally think if EBC thinks about to promote brain health, I think we should form a European brain plan, which is actually then led by EBC, and where I think the national societies can then actually contribute with their specificities. I mean, we've heard that about Denmark before that, so obviously there is a closer link to politics. I personally find it very difficult in Germany to link up, for instance, with politics. They are theoretically interested, but practically not. So, how do we pursue? What is the way to go? The other way, I mean, we had two, I mean, like Brosch, we have two, representatives from industry. I mean, how do we link up here? Because I personally find that linking up within the brain plan, sort of with stakeholders, is usually more easy. But then link up with, let's say, politics and support systems is more difficult. So my plea would be really for EBC, let's do a European brain plan, and then in addition, put that together, all the initiatives, because then I think we should be stronger.
Thank you so much, Peter. So I've seen Fred nodding vigorously to the idea of a European brain plan anchored at the EBC. Henrik, what would be your recommendation?
I think this is a very hard question to ask, to be honest, because I definitely see a lot of potential in a European brain plan coming from EBC. But at the same time, I think there is a lot of national differences also in how we meet politicians, how we cooperate with the industry, entrepreneurs, others. So I think we also need the possibility to adapt to national levels. And by the experience we have from our brain plan now, or the brain health strategy, which it's called, is that it's hard to find, as I said earlier, the good measures or the actions that we should take within the health plan. So I think maybe if we could collaborate more on finding the good actions for gaining better brain health in the different countries, that would be great. But I think that a finalized brain plan, trying to adapt that from European level to Norway, for example, would be quite difficult. I will give you an example on what I'm talking about when I say finding better measures. Regarding treatment objectives in a brain plan, we know that our healthcare system is under huge pressure. And if we ask all our members, what would you like in the next brain plan? A lot of them will say they need more resources regarding today specific brain disease. But it's not necessarily the way to go, because it wouldn't add up. We cannot get more resources to every specific area within brain health. So I think we need to look at new solutions and actions that benefit more broadly within brain health and brain diseases. An example to this is to take the perspective of main health challenges that people with brain diseases meet, and build new structures in primary healthcare services for meeting those needs, and not diagnose specific healthcare all the time. So I think we need to collaborate on finding those new actions and those new structures that we can implement with the brain plans. Thank you.
Super, thank you very much. And now going to Azad and Marco with this question, a potential European brain plan. How can industry, investors, market actors be usefully engaged in such an exercise?
So I think for any collaboration, whether it's a small scale or large scale, what's important to know is, of course, what are the goals, as well as, what are we bringing that's different to the table to help each other toward ultimately the goal, in this case, of treating disorders of the brain, improving brain health. So I guess what I would say is that I can't speak for for the company. What I can say is there is absolutely interest in, personally, I can say, based on how I perceive it, there is interest in these collaborations at the research level all the way to access, as I mentioned earlier. I would say from our perspective, one of the things that would be good to know is what are some key sort of more concrete, asks. And as Marco mentioned, you have to make this a win-win situation. So maybe this could be a bit provocative to a question to, for example, to Peter, but it would be really good to know whether digital, for example, data can be available, because that's really important. We live in an age of data, and data, as everybody's aware, of analysis that leads to more ideas and sort of faster way of whatever we're doing, for example, in our case, treating patients with neurological disorders. So I think that would be a question that should be on the table.
This is extremely interesting. So both the question of goals, not an exercise for its own sake, in order to have a beautiful blueprint that we can all be proud about, but it's also an exercise that actually moves the needle in the field, and concrete aims, and in this case data. Well, it could be a double-edged sword, obviously, because if you set the level of ambition high, as you would with a data space type of exercise, then yes, it's a high risk, high reward type of operation for whoever embarks on drafting this European brain plan. But I'll be entirely with you that it's better to aim eventually after such ambitious undertakings rather than just to collect some low-hanging fruit. Marco?
Yeah, I mean, I'm wearing my business hat on, and so I think we need to just make it concrete. Okay, so I think we need to find a framework, agree on it. I think we are there. Then I think it's Henrik who said, what are the specific actions? Okay, and I would say, what are the priorities? Because the determinants of brain health and brain capital are multifold. Okay, and you can argue to invest across the spectrum in everything, and I think it's impossible. We need to see whether there is any one determinant that has a greater impact that we want to prioritize. Okay, and I think that. And yes, we need to aim very high, but we also need to aim at something that we can achieve, because otherwise we will never get there, right? And we will end up spending a lot of time just discussing, concepts, which is important, but not necessarily then conducive to impact. Okay. Now, impact is difficult to measure. Okay. You have outputs, that are easy to measure, but you have outcomes that are hard to measure. And particularly when it comes to mental health and brain health, we simply don't have good enough data in some conditions, right? So I guess an effort, I wholeheartedly subscribe to what you said. We need to have, or the health systems need to be part of this, and need to have open the access to the data in a compliant way, in a way that is obviously irrespective of rules and privacy and what have you. But we need to measure our impact. We need to measure our outcomes, not only our outputs or our activity for that matter. And so invite, ground it, prioritize, and then invite actors that are ultimately asked to put money, behind these priorities, which is not necessarily only governments. It's pharmaceutical industries, it's big investors, it's entrepreneurs, and it's, I would say health systems as well. So private and public.
Excellent. Thank you so much. We have now 6 minutes remaining, and I have seen already one question or comment. We need a mic too. So we need the microphone. Yes.
Good afternoon, everyone. I'm Mika Pykö from Finnish Brain Association. I'm executive director there. And we Finns are not very sophisticated speakers, and we are not used to give any compliments. But today I can really thank to every speakers for a very interesting presentation. And what I really wanted to say that I have shared that kind of short summary or brochure concerning our brain health program, which we launched in Finland about a year ago. And listening to these discussions today, it seems to be so that our program includes already a lot of elements which we have been talking here. It has only 3 or 4 outcome goals which are measurable, and we have an idea to implement the program by using outcomes contracting approach. And maybe we are talking more about outcomes contracting during the session concerning impact investing. So my message to you is that we are really happy to share our experiences and change ideas with you, because we really believe in collaboration. Thank you.
Great, perfect so much. And please take a look at the leaflet that has been circulated. George, you are next. And we need the microphone.
I'm going to go back to the question about whether we need a European plan or a national plan. And I think that you may need both, of which there are certain elements that are European-wide and certain elements that are national-wide. My own organization has a clinical trial system that extends from North America, 100 trial sites, to Europe, to 50 trial sites in Europe. One of the great impediments to more effective and efficient clinical trial operations in Europe is the fragmentation that we find in ethics review systems, regulatory systems, and the like. And it would be a real move forward at the European level if we could develop a trusted mechanism for ethics clearance, patient safety, IRBs, review boards at a European level, as opposed to each national level. We did this in the United States by creating a platform and then having all of the clinical trial sites basically say, we adhere to the platform's IRB. And then basically they would always have at the local level a check that they could look at it to make sure that patient safety is protected at an academic or private site. But having a uniform approach to certain elements to overcome the fragmentation in Europe would be terrific at the European level, but allow enormous flexibility about how individual nations actually conduct a brain health plan. But I would suggest that you ought to think about a European level element of a European approach as well as a national level.
Okay, thank you very much, George. This was extremely useful, and we have obviously a lot of fragmentation also in an area such as medtech, where theoretically we have the same approach and the same regulation across the EU, but member states add their additional requirements. And therefore, having here a genuine single market for medtech devices would be extremely impactful. I'm looking at Marco, who's
on the regulation side, great. And when it comes to payment, is really, really hard. I mean, we're very far away from unifying and standardizing or harmonizing, if you want to use it. Yeah. Yeah, budgets are a matter of national priority, and now it's being pushed down to regions, and within regions to God knows what stakeholders. So I think it's getting harder on that front, not easier, to get healthcare paid for when it comes to public funding.
Yeah. Thank you. Any further? Yes, there is a comment from Peter.
Yes, thank you very much. Well, first of all, I think Henrik, I think that we need both. I mean, I think there should be a national, let's say, element to that. But I mean, for instance, agreeing on the basics, what should be a brain plan about? I think we should have a European idea. As the past president of the European Psychiatrists, I have started a project on European guidelines on mental illness. And when I started with 44 national psychiatric associations, people thought I'm crazy. But we made it, and I think it helped us to bring together what is really essential in the treatment, for instance, of depression and so forth, pan-European. And I think this is what we should dwell on, what is essential in order to have a successful brain plan. The second thing, George, yes, I would say data. I don't have any problems in exchanging data and have a data lake. And coming back to, oh, no, sorry, that was Azad, the data. And coming to George, I think the only thing you should take in account, America is one country and Europe is several countries. And I think that, I think the holes we have to dig much deeper. I don't want to say that we don't need to go in that way, but possibly we need a bit longer time for that.
Great, thank you very much. Any last comments, any last questions, first of all? No, then any last comments from the panel about how we should go about this? Is now the moment? Is it better to be focused or all-inclusive? And so on and so forth. I'm looking at Henrik as well.
I would just like to end by saying that we are absolutely positive to have more contact between the countries with brain plans for sharing experiences, like Mr. Bassetti suggested earlier on, and which we're talking about now. So we also favor collaboration. Thank you very much.
Yeah, thank you very much. Peter, is it an old hand or a new hand? And he's
it's just a thumb up, so I
enthusiastically supportive. Azad and Marco.
I'm borrowed this quote from, I think it's coming from Tom Insel's book, and he said there was somebody who stood up and said, "The house is on fire. Let's not talk about the chemicals in the paint." And so what is meant by that is we sometimes zoom in on the nitty-gritty, smaller, and try to get things right, maybe even the biology, try to really understand, and we should do that. But the house is on fire. Okay, there are other priorities as well on how healthcare is accessed, delivered. Mental health is a big problem. The burden is very clear. So let's try to think, holistically, but also not only about treatment, but also prevention, and also how we deliver mental health services and brain health technologies to patients.
I just want to say that to thank you for being for including me. Just want to leave you with the thought there are people who actually are thinking about even enhancement of brain function. I was in fact at a science and diplomacy summit in Geneva last year that was focused on the science and beyond the science of how you improve brain function. And so I think there's, of course, we have needs all across the board. And it's still, in the end, of course, it requires collaboration. But I just want to reiterate that we do need to have concrete objectives. And, we're all willing to play our parts.
Yeah, thank you so much, Azad. I think the question of the ethics of neurotechnology will be extremely important in the future as well, as new applications come to the market, apart from DBS and cochlear implants, which are the two most successful and widespread examples for the moment. So that has to be watched very attentively. So let me conclude by saying that I sense that there is enthusiasm for attempting to go European with these brain plans. I think the moment is opportune, to say the least. Such an opportunity comes every 5 years, more or less, to seed ideas for the EU and associated countries, because a lot of leadership comes from Norway and Switzerland, needless to say. And of course, the question that needs to be urgently addressed is what are the goals? What are the tangible objectives? One shouldn't aim to grasp too much without hoping for the results to be very clear. And lastly, I think it would need to be an evolving type of brain plan that would need to be updated constantly, right? It's not something cast in stone, but it would definitely need to be a type of frame of reference that evolves with the times. So I leave you with that thought, and I would like to thank the panelists for a splendid conversation today. And I hope when we meet next time in Basel in a year's time, we will have advanced in this journey. Thank you so much. And we now have a 11-minute coffee break before the next session starts at 3:15.
And it's my honor and privilege to introduce to the floor. Folks, can I invite you to carry on the conversations outside if that's really something important? Really sorry to interrupt. I don't mind you carrying, but it's just that We are a little bit taken by time, plus our virtual audience that is still with us. We now have a talk on brain health for society, scaling what works to add years to life and life to years. I found that extremely poetic, Kana, when we invited you to talk about that. But with us this afternoon, we have Kana Enomoto from the McKinsey Health Institute. And Kana is Director for Brain Health at McKinsey. So over to you, Kana.
Thank you and good afternoon. I was looking at the dimensions of when people have brain health conditions and do they miss work and do they have it impair their friendships, et cetera. And I just had a migraine this morning. And so I was a little late and I thought, oh, I can check those boxes because my own neurological condition affects my ability to participate sometimes. But I'm grateful that I have the treatment and the support and the accommodations that I need. I would say on the mental health side and the substance use side, we're not always so lucky. And so when I talk about brain health, I talk about mental illness, substance use, and neurological conditions. Sometimes though, in my presentation, you'll see it's based on the data that we have or the particular analysis. I'll flip back and forth. So sometimes we are talking broadly about brain health, but then some of our tools and our assets and our analyses are specifically about, the set of conditions for which we had the data. So I'm Kana Enomoto. I'm Director of Brain Health at the McKinsey Health Institute. I spent my career trained as a psychologist, spent my career doing public policy in the federal government, and then came over to the private sector. And so many of you have referred to public-private partnerships today. I came to the private sector because I had realized that at least in the United States, we'd made a lot of progress on advancing science, on advancing practice, on advancing policy to better address mental and substance use disorders. But I found that the private sector actually was lagging significantly. And that people had a very simplified view of what these issues were and really how important they were. And so I came to McKinsey because I wanted to change that narrative and really advance the thinking on the private side. So I'm excited to have this combination in this room, which is one that I strive to achieve too, which is bringing those voices together, which is so important. So our McKinsey Health Institute, we're a nonprofit generating entity within the McKinsey & Company. And so the work that we do is entirely invested. It is not commissioned by our clients. It is driven by a commitment to adding life to years and years to life, with the conviction that we could add up to 45 billion more healthy quality life years to humanity in the next 10 years if we invest in what works and if we take holistic approaches to health. And when we talk about health, we're talking about physical health, mental health, social health, and spiritual health. And we've looked at this across 25, 26 countries. And, it is tremendous to see the variability. I think in some of the European countries, you have much less value on, say, spiritual health than in other countries. But in some countries, you see that's like the leading factor in how people consider their health. And so we take these together because globally, we know this is really more how human beings experience their own well-being. What we do, we bring together leaders, we do convening, we are doing our own research, we're promoting and creating open access data sets, and then also trying to stimulate innovation. One of the areas where we're doing probably most of this is in our brain health space, where we're talking about bringing together private capital. How do we incent private capital? I'm excited for the next conversation. And then also, how do we bring together that with government, with philanthropy and traditional investing to do new things to not only spur innovation, but I think just change the narrative and create a more sustainable approach for brain health across the world. So at MHI, I said, add life to years and years to life. And this, all of you are very familiar with, but, we talk about squaring the curve in terms of our 45 billion ambition. So it's not only in enhancing the average quality of life, it is also extending the increased global life expectancy. So we have a healthy longevity initiative. And George was saying, well, people don't want to necessarily live longer. And that's because you have this steep decrease in quality of life. So why would we want to spend up to half of our lives living in poor health? Of course, that's not a bargain for anybody. So the ambition has to be to do both, to raise the quality of life over time, as well as extending it, right? In some places, maybe we don't need to extend it as much, but certainly paying attention to the brains of older adults is essential to ensuring healthy longevity. Some other work we've done is looking at, with our friends at IHME and Bill and his team, we looked at the IHME data. We looked at what is the global burden of disease. We broke it down to a select group of mental and substance use disorders. We've done this for all the countries that are in the IHME data. But then we also took it another step and looked at, well, what are the concomitant physical health conditions that so commonly occur or have a high probability of occurring for people with mental and substance use disorders. So we know people that have alcohol use disorder are more likely to have, obviously, cirrhosis of the liver. People with serious mental illnesses often have cardiovascular disease, metabolic syndrome, and so forth. And so we did an analysis and found that you could, if you looked at just pretty tightly related secondary health conditions, that you get up to 333 million disability adjusted life years across the world, almost half of which are coming from the physical health conditions that are related to mental and substance use disorders. And we know in analysis of healthcare claims in the United States, most health plans, commercial health plans, let's say, have between 20 and 28% of their populations have a diagnosis of a mental or substance use disorder. That population in a commercially insured, right, set of plans is driving between 40 and 50% of healthcare claims. When you get to Medicaid, which is our lower income insurance, and Medicare, which is our older adult insurance, you're looking at 50 to 70% of healthcare claims are attached to people who have one of these diagnoses. So there's a strong economic imperative to look at these issues. One of the challenges that we have, though, is oftentimes policymakers think there's really nothing you could do. I mean, Peter, I think, said it very well, is that they're interested in our plan theoretically, but not practically. And I have found that as a policymaker for 20 years, that people really didn't understand what was at stake and how was it at stake. And then they would say, and I have testified in front of Congress many times, and people would, I mean, I'd have lawmakers saying, look, I don't care what you're saying, you're from SAMHSA, you're from HHS, but I've had family members who went to treatment, got better, failed, went to treatment again, got better, failed, went to treatment, didn't get better at all. And so how can you tell me that we should invest in you when you cannot, your system cannot provide results? And so then they don't invest, rather than, right, like ensuring that they're investing in good quality care, ensuring that they're investing in evidence-based practices, and they're providing the support to the system to enable our providers, our health system, to really deliver care that works. And so what we did was we looked at, and also we have an inadequately staffed system. We don't have enough workforce. We don't have good data. What we did was we looked at the interventions that exist, right? It's not that the interventions don't exist, and many of you are developing those interventions. It's that we really don't have the systems to deliver those interventions well. But if we suspended disbelief and we said, but what if? What if everybody who tried a first-line therapeutic wasn't successful, got that second-line therapeutic, had the support to persisting care, got the psychosocial supports that they needed? We think we could alleviate 140 million of the 333 million life years we talked about before. And this isn't necessarily to, like, you shouldn't do your economic sizing on this. This is really to give people hope. This is to say, even without more innovation, we have tools today that could alleviate the burden that we will see tomorrow. And it is incumbent on us not to accept the fact that we don't have enough workforce, or there's too much stigma, or people don't want to get care. If they don't want to get care, if there's too much stigma, that's on us. And one of the ways that we think we can innovate this and move toward this is to take more innovative approaches to financing. And I won't go into this now because I think you have some great folks talking to you next. But just to say, we have partnered with Wellcome Trust, with Kokoro and Clinton Global Initiative, and are convening leading funders from around the world to talk about how we can have these conversations, not just in North America, but in Europe, Africa, Asia, South America, and so on. We also have a really amazing health tech network at McKinsey. And so for those of you in the room who are founders or funders, please, happy to connect you with that. We have 3,000 CEOs, investors, and founders who are engaged in an active conversation about how do we promulgate innovation and really harness private capital in a way that advances brain health. And the question of where should we invest? I know many of you talk about Alzheimer's dementias, older adults, but if we look at this, if we look at the distribution of disability for people with, these are primarily mental and substance use disorders, you see that the pink category, the blue category is mental disorder. And the pink category is physical health conditions. These conditions, right? Like the mental and substance use disorders, 50% of them are showing up by age 14, 75% are showing up by age 24, and they are presaging, predating, or predicting these physical health disabilities. And so I think if you ask, where should we invest? Where do we need to invest? And where will we get the most bang for your buck? The answer is very clear that we need to look at early childhood and adolescence. Because we can catch these problems before they cause other big problems. One area where we're spending a lot of time, and I think in Europe you have a much better access to these interventions, but early intervention for early psychosis. In the United States, our primary model is coordinated specialty care. But even just in the US, schizophrenia, the burden of schizophrenia is $343 billion in a year. And a lot of that is coming from the primary healthcare costs, but also tremendous loss, economic loss from caregiving, premature mortality, unemployment, hospitalizations, and criminal justice involvement, unfortunately. And so when Harris talks about brain capital, I was so excited to hear the concept because I was like, yes, like this is brain capital we should be preserving, right? And the science tells us like it's very effective. You know, if we have access to these programs, we can help people, you know, improve their health, improve their employment, stay in schools, get jobs, get married, be you know, productive members of society and prevent brittle condition. But we are failing to preserve the brain capital of this particular population. And this is just, you know, this is on us, right? The technology is there, the know-how is there. We just need the will and the investment. And how do we get that investment? How do we get that will? So we partnered with Patrick Kennedy. Congressman Patrick Kennedy is the nephew of JFK. He is a well-known advocate for mental health and substance use and brain health in the United States. And we partnered with his nonprofit to develop a systems map. And I heard many of you talk about multi-system, cross-sectoral collaborations. We built this tool to help, you know, so it's not just like the super experts who belong to the European Brain Council, but also like your everyday grassroots advocates and organizations. This is an interactive tool where you can pick your particular issue and say, well, you know, actually, all of these sectors have a role to play, right? It's not just industry, it's not just government, but it's also employers, media, people with lived experience, you know, the health plan. So health is just one sector on the overall ecosystem that we need to engage to make the changes that we're trying to see. And then this is a tool, it's very cool. Happy to share the link after, I encourage people to check it out. It's really fun. And then also, I think what we lack, and I heard this in the earlier presentation on some of the national brain health plans, is that we actually don't have clear, measurable goals and a pathway of getting there. And one of the investors that we've brought into some of our conversations on innovation in that space, he says what we lack in brain health is not a lack of capital. Right? There's 2,500 billionaires in this planet, 250 of whom have taken the Giving Pledge, right? So there's $3.8 trillion of capital, that's going into philanthropy and social impact investing, et cetera. What we lack is ambition. What we lack is ambition, because we often advocate for more of X or more of Y, and then when we're lucky, right, our parliament or our Congress gives us 10% more. I mean, it's 50% more. It's tremendous, right? But in the United States, only 1 out of 10 people who needs treatment for a substance use disorder, maybe 5 out of 100 people who needs treatment for early psychosis gets the treatment that they need. So if we double what seems like a very big number already, we get to 10% or we get to 20%, and that is wholly inadequate. And so we need to elevate our ambition along the lines of the UN AIDS goals, right? 90% of people with HIV should know their status, 90% of people with HIV should start ART, and 90% of people on ART should achieve seronegativity. In 2014, when they launched those goals, people thought that was crazy. They thought that was overly ambitious. In 2012, only about 1 in 3 people with HIV had access to ART globally, right? And now, they're moving to 95, 95, 95, and they have 86% of people with HIV have ART, and those on ART, over 90% achieve seronegativity. And that has occurred in a decade. 10 years they did that. And in fact, the lower middle income countries do better even than some of the higher income countries. So there is nothing to keep us from setting those ambitions for ourselves, for brain health, that 90% of people get an annual screening for their brain health, whether that's neurological disease, mental illness, or substance use disorder, whatever is developmentally appropriate for that individual. Why aren't we screened? Why isn't that the expectation that every year we get asked these questions when we go for a checkup? 90% of people who get screened and have a need for treatment should have access to evidence-based care. Not just the care that the individual provider decides to deliver on that day, but our health system should have ways of understanding if people are getting care that meets the duration, the dose, the intensity, and the evidence base that shows that it is effective for that particular condition. And then 90% of people, recovery should be our expectation. Especially for the serious mental illnesses, we see a lot of people just sort of getting, or dementias, right? Like, while maybe we're not going to get a cure, people can set goals, families can set goals, and people can make progress, and that should be the expectation, right? We should not be relegating people to a life of hopelessness or maintenance with disability, right? Recovery could mean being housed. Recovery can mean, I want to learn how to 2-step dance. I want to learn, I want to get my own apartment, right? Recovery can mean different things for different people, but that should be our mindset, and that should be for everybody, not just a few. So thank you for letting me chat with you. I would encourage anyone who's interested to look at the MHI QR code there and join our community. But most of all, I really appreciate having folks who are in this conversation, in this fight together, and look forward to future partnership and achieving better brain health for everybody. Thank you.
Thanks a lot, Kana. And we can really take your words as an expert by experience, but also a very strong advocate. And thanks for this refreshing invitation to open the box of ideas and this blue skies thinking. I will really take up your words for the conversation part that we have at the end of this afternoon. So I'm inviting every one of you, every single one of you, to actually follow what Kana just told us, is like come up with your ideas, and I would even say your crazy ideas. It's now time to indeed think big. And it would be really interesting to really nurture the conversation later on. But without further ado, we now have another panel conversation that is going to be moderated by colleague Rim Ayari. Rim is a professor of banking, finance, and economics in London, but also, and very importantly, the founder of the Euro-Mediterranean Economist Association. So, Rim, you'll be surrounded by colleagues on your panel, again, in person and virtually. but I hand over to you for the masterminding and moderating of this session. Over to you.
Good afternoon to all. Thank you, Fred. Thank you, Harris. And thank you, everybody, for this great day. I understand that I have here 2 panelists, and then I have 3 connected online. I see Shiva. Hi, Shiva. Hi, Christian. And we still have another colleague, Natalie. So after quite, I would say, dense day, we learned a lot even further on brain capital and how we could advance this new concept framework. As you mentioned, Fred, I'm an economist, a professor of financial systems, and all my interest for many years now has been how to channel finance to deal with our societal challenges. And I assume that this is a great societal challenge that we are dealing with today, brain health. And not only this, but if we look at the risks that we listened to at the World Economic Forum, I think we have huge work to do, and we need to put our collaborative approach together, or we have to collaborate, economists, neuroscientists, psychiatrists, psychologists, finance people, and sociologists, to really find a solution that is not simple. It is complex because the problem is becoming very complex. So this panel is about brain capital and impact investing. So in reality, the 2 concepts are real. I mean, of course, brain capital is very new, and also impact investing is quite new. So in fact, I remember in the financial crisis in 2008, very, very few people talked about impact in finance. So practically back then, the main really intention of finance people is to maximize financial returns, irregardless of the social and environmental impact. And I think this was, I would say, a logic since the Washington Consensus in the 80s to enhance or to maximize economic growth. But I believe that we need to rethink and to try to understand that we are part of a system, environmental system, societal system, and we need to think of conditions and we need to think of constraints. And those constraints, and the first constraint, it's first, of course, us as a human beings. I think we are not indefinite asset. I think we have a beginning, we have an end, and we have to preserve our, I would say, bodies and mind, and hence we have to preserve the asset, the individual asset over time. So brain capital. I would like to introduce these 2 concepts briefly, so then we can frame this discussion together. Brain capital is referring to an economic value of individuals' cognitive and emotional abilities and brain health, much like a concept of human capital, which economists, they know, they use, they valued, and we encompass, in fact, their education, skills, and overall health. So we didn't go really into the advances of neuroscience there, because in general, disciplines are quite separated and each one works alone. But nowadays, I think we need to start working together to integrate those advances in neuroscience and in other disciplines into economic policy. So in fact, brain capital emphasizes, in fact, the cognitive and mental health aspects, and I think we need to focus on those, recognizing, in fact, the importance of mental wellness, well-being, creativity, innovation, intellectual capabilities, and also all these aspects are driving economic growth and well-being overall of the society. So, I mean, of course, we need to develop the models for understanding better these aspects, but in fact, theoretically, this is what it is. Now, investments in brain capital might include all initiatives that promote, in fact, brain health, cognitive development, innovative thinking, and more, I would say, innovative education systems which allow us really to integrate these advances of neuroscience. Now, the impact investing is an investment strategy where the goal is not only to achieve financial returns at a simple term, but also to create a positive impact on the society and on the environment. So we do not, in fact, harm the environment. And I would add something else, which is the impact on humans and communities. So then we need to really think a bit comprehensively in that respect. So impact investors in general, they not only seek financial returns, but then at the same time, they would like to have an impact on the society, on the environment, and other things. So for example, nowadays, many impact investors, they are investing in renewable energy, social housing, other businesses that in fact have community aspect. And the metric that they are using, in fact, all this ESG and many other, in reality, many other financial institutions nowadays that are subjected to the ESG, which is environment, social and governance indicators. Many financial institutions in many countries are against these metrics because they think this is quite uncertain, it's very difficult to assess, and we need to only look at one metric, which is the financial returns. But going forward, I think we need to find an appropriate way to connect all these aspects. Now, combining these two broad aspects or concepts, that is brain capital impact investing, of course, we enhance the complexity. And obviously here, we need to understand a little bit this in terms of how to achieve economic outcomes that are not harmful to the environment, to the humans, and also to the society overall. So we need to be, in a way, much more considerate to broader aspects of the economy and of the society. So for this panel, I have the pleasure to introduce, in fact, 5 panelists. Eckhard Ernest, who is the president of Geneva Macro Lab and also chief economist at the International Labour Organization. Natalie, I don't see her. She's not there yet. So Shiva Dostada, she's the head of the European Investment Bank Institute. Christian Schwetz, he's Golding Capital Partner, who is an asset manager, investor. And Dan Mannix here, he's from the Brain Capital Alliance. So I would like to start with Eckhard. Eckhard, you have 5 minutes to give your introduction, and then we can discuss these aspects of brain capital and impact investing, and how do you see the future of all of this from an economic standpoint, please.
Excellent. Thank you very much, Rima, and thanks for the invitation. Great to be here in Basel, even though the weather was much better in this morning in Geneva. Just saying. Rima asked me to make this link between brain capital, natural capital, and labor, because I mean, as she mentioned, I'm working for the International Labour Organization, so the link to brain capital is not exactly evident. So I'll try to do that in 5 minutes, and then end with maybe a question that I haven't heard so much discussed today. The first point is what is kind of really obvious from all the discussion we heard so far is that healthy cognitive development is really important for being successful in one's job, especially when you think about the current transition towards a knowledge economy where we all work much more cognitively than with our brains more than with our brains. But when you look at the latest publication that the ILO has published just 2 weeks ago, we see significant deficit in what we call decent work. So around the world, we have maybe enough jobs, but jobs of poor quality. And we actually see a slowdown in the progress that we have made over the last, let's say, 20 years or so. So there's still progress, but it's much slower and slower coming by. We see a lot of poverty, working poverty. We see a lot of people working in really poor working conditions. And obviously that will affect their capacity to develop their cognitive, their mental capacities. One particular element I think is important to highlight, which we haven't, just discussed in passing, is the educational impact of the pandemic. You saw maybe for those of you who are familiar with these studies, the PISA results from the OECD, which kind of measures the educational achievement of 15-year-old, enormous setbacks, drops of 5-6% in some countries in terms of the performance over the pandemic years. And that has long-term implications, obviously. So there is a clear implication of lack of cognitive development with the potential later on of these young kids to fully integrate the labor market. The second point, and that I say that specifically from a perspective of most of our member countries, which are in the global south, healthy natural environments, natural healthy ecosystems are not only important for climate change, for battling climate change and for preserving biodiversity, they also provide the backdrop for healthy cognitive developments. I mean, here I really don't say something new to you. Mal and undernutrition is critically affecting brain health. Insecurity, poverty, and environmental pollution all have a price through not only the destruction of natural capital, but also through the destruction further on brain capital. And then a third point on this is, I think what I like particular with this terminology of brain capital is that it allows us to find a common language to align different policy and approaches. Kana just before had really given us some really interesting figures here. And I think I would totally subscribe to that idea that having a common language, having a common denominator is really important. In UN speech, we call that a whole of government approach, which is really to make sure that policy initiatives of labor markets, of labor ministries, of economic ministries, finance ministries, and health ministries are aligned. And you can only do that if you find some common denominator. So capital here, in this sense, is the common denominator, because on the one hand, it allows you to measure the opportunity cost of unused potential. And that's not only about unused potential later on in life, it's also the unused potential that you have and you don't develop your cognitive capacities as a young person entering the labor market successfully. And here, I think in particular, when you look at the prospect, especially of several African countries, where a lot of young people do grow up in environments that are significantly harmful for their cognitive development, these young people will constitute the bulk of the global population 15 to 20 years from now. And that's in addition to all the cost of maintenance of healthy brains that we discussed in terms of cognitive maintenance at the later stage of your life. Last point, and that's where I said the missing element, which I think we haven't really discussed about, and maybe this panel will allow us to go into detail on this one, is that my understanding, so my belief is that we do not, we need to restructure also our way of interacting to take account of these changing population shifts. Somebody said this earlier in the panel, that we're seeing an increasing longevity, which is great, but that also means that the heterogeneity of our workforce is not only, the diversity doesn't only come in terms of gender diversity or ethnic diversity, it's also about age diversity. We need to bring in older people. And I mean, I'm saying this from a perspective of somebody who really reaches that level himself. So I think that it's really important to kind of understand how do we actually take advantage of that. There is different perspectives on innovation. Brain plasticity, as you obviously know, is much higher in younger age. And so for people like myself, maybe it's much more difficult to kind of adapt to new procedures, to new approaches. On the other hand, experience capital, so the experience that I have acknowledged or developed over my lifetime is obviously important and should kind of figure into that equation. So I think that I want to leave you with that question: is how do we need to structure our interactions to in order to make sure that these kind of shifts in the composition really take advantage, so that we have this heterogeneity of brain capital that we all bring to us, and at the same time maybe allow us to also maintain that brain capital by allowing people to be active in the labor market much beyond their retirement age. Thank you very much.
Thank you very much, Eckhard. I think this already gives us quite a broad scene on how really we can transform even our thinking and transform the outcomes in the labor market. And this is something that is really very, I would say, novel approach based on the societal challenges that we are facing, specifically the demographic changes. So I would like to go to the screen, and I see here Nathalie Helmi. She's the head of environmental economics at the Centre Scientifique of Monaco. We can learn a lot from Nature Capital, and we have already had quite of a discussion last week specifically about this topic. Nathalie, how the Nature Capital and how all of these aspects could be used also to learn and how to value a brain capital, please.
Hello, Reem. Hello, everybody. Nice to be with you today. I would like to share my screen. Can you see it? No. Is it working?
Yes.
Okay. So, as you said, Reem, I would like to talk about natural capital. And I will start with So I will start with global warming, and global warming is impacting our ecosystems and therefore the natural capital. This is from IPCC report, and you can see that human influence has warmed the climate at a rate that is unprecedented, at least the last 2,000 years. And we are already 1.1 degrees Celsius warmer than the pre-industrial times. And this will cause extreme heat, heavy rainfall, drought, fire weather, and the ocean is warming, acidifying, and losing oxygen. Here we can see that future emissions will cause future additional warming, and you can see here the different scenarios done by IPCC. This will cause more warming, and you can see the difference between the different levels of warming. At 1.5 degrees Celsius, the warming will be already a lot. At 2 degrees Celsius, it will be much more reddish, and at 4 degrees Celsius, it will be an almost uninhabitable planet. And for the biodiversity, you can see here the difference between 1.5 degrees Celsius and 3 degrees Celsius. The difference is really important. And now if we want to evaluate the biodiversity loss, we use ecosystem services, which are the services that nature renders to the humanity. And we have 4 categories: supporting, regulating, provisioning, and cultural ecosystem services. And what we can say is nature has crucial services for the human, like pollination, coastal protection, tourism, food sources, climate regulation, clean air, water filtration, and health, of course. This is for the value of coral reef. We have different ecosystem services that we can evaluate, like coastal protection, health, marine life, flood protection, tourism, and food production. And this slide is from IPBS, and you can see that the people value nature in different ways, depending on their knowledge systems, languages, cultural traditions, and environmental context. And depending on the different view that we have on the nature, the value will be different. And this will also impact the decisions taken. There is no shortage of methods and approach to value nature, but their uptake into decisions remain limited until now. And this is still from IPBS, and you can see that transformative changes needed to address the global biodiversity crisis relies on shifting away from values that overemphasize short-term and individual material gains to nurturing sustainability-aligned values across society. And this is a very interesting graph that we can use for brain capital as well. And this graph is to show you how much the ocean and the land can be important. So nature-based solutions are very important as natural carbon sinks, and they help to mitigate the climate change. So in conclusion, nature can be 1/3 of the solution, and we need to conserve natural capital against climate change, and prevention is possible if we help nature to resist these environmental changes, if we maintain the genetic diversity and restore certain ecosystems, if we help communities to adapt, and we raise awareness. And it is important, nature is important because we live from nature, with nature, in nature, and as nature. And thank you for your attention.
Thank you very much, Nathalie. I think this also gives us a broader picture on the environmental challenges that we are facing as humanity. Of course, in the worst case scenario, the planet wouldn't be habitable. And of course, this in the process of the worst case scenario, the impact on brain health will be huge. And I think this is also important to start thinking in an integrative basis, not really in a silo approach. So we look at the challenges so far that are completely separately, but we need to really have a comprehensive view of the challenges that we are facing. And above all, as humans, we will be, of course, affected not only because of the global warming, as Nathalie mentioned, but also in terms of the scarcity of resources, water in certain parts of the world, and also enhanced pollutions overall. And this, in fact, will impact our health overall, and in particular our brain health. So next, I would like to give the floor to Shiva, European Investment Bank Institute. I'm sure that you had a lot of thinking about how the EIB is a bank that, in fact, it's one of the most sustainable banks in Europe based on the indicators. And I think you have most probably the highest green asset ratio in Europe. So Shiva, how do you see your role going forward in terms of channeling financial resources into sustainability, and also into enhancing or developing this brain capital economy? Because there, as you could see, there is a full correlation, and we need to go and work in parallel in these two aspects. Please, Shiva.
Thank you very much, Rim. Indeed. So let me very briefly, maybe for those of you in the audience and online who are not maybe as familiar, just introduce quickly the EIB, the Bank of the European Union. So we are indeed owned by the member states of the European Union. And then there's the EIB Institute. So the bank, you could, because the panel is called, it's about impact investing, you could actually refer to the bank as an impact investor by its design, because when we were founded, we were from the outset in our statutes, it was very clear that we needed to finance projects. We're not just a regular bank that writes a check and then you can do whatever you want with the money, but we actually, in every investment, every project, that, you know, the project is actually scrutinized for the impact it has on many measurements, including, you know, obviously social measures as well. Now, it is a real pleasure to be in this forum. I wish actually I was there in person, because I know that we're missing out of all the networking and meeting everyone, because I personally am fascinated, and Pavel and Harris, I think they know, I'm just fascinated by the, how should I say, the potential that there is, but I'm equally also a bit at, every time I mention to my colleagues in the bank, but also outside in the financial community, that there is a brain capital and so on, I realize that the narrative is not there. There is really, I guess maybe it's so obvious that we don't think that the mental capacity is absolutely essential, and brain health means a healthy economy. but I would definitely like to highlight that there is a lot of work that needs to be done to translate all the really important work that the various speakers today have presented in a language that the financial community can get its head around. And here I would perhaps then maybe briefly come into the EIB and our role, the way we come into this, which is we are a lender. So if you think of all the discussions that happened earlier, that the budgets are scarce, across member states, across the world. So clearly, what is important is indeed to look at those institutions like the EIB that are effectively working in at the bridge between the subsidies and the grants and the private capital by coming in very often into projects earlier, staying longer, de-risking and becoming catalytic. And this is in fact where I would like to therefore make the second point of financial innovation. I believe that there is potential to really take, as part of this wider initiative that is now happening, to look at the investments that are needed both in health systems, but also in terms of the innovative companies, which are more, for many of them, they will be deep technology companies that need patient capital. So basically understanding where are these investment needs in terms of the actors, because at the end of the day, when it comes to the EIB, we will need a borrower. We need to understand whether the borrower is a public borrower, public sector borrower, a private sector borrower, what size, whether it is a risky investment or one that is actually less risky because it is maybe part of a public sector investment. Because with that, the financial innovation that can then come in and that we have now examples on, and it was nice to see the nature-based presentations, but we have obviously examples from our pioneering role in issuing green bonds in 2007, and they have become in the meanwhile sustainability awareness bonds. This is obviously a huge market, many issuers in that space where you have a use of proceeds towards SDGs or green investments. So that's a financial innovation that perhaps needs to be maybe looked at as a way to channeling private capital through the bond issuers into banks that then make those investments, or into corporates that then make those investments. And then second, we also have a financial innovation. We've seen that in the EIB with infectious diseases, where we have, already in 2015, we set up a facility which was a blended product. So we took grants from the European Commission, and we actually got therefore protection to go into very high risk infectious diseases, vaccines, and products that were not bankable. A regular bank or an equity investor would not have been able to do so, but it gave us that risk sharing, the ability to come in, therefore, into these projects. Now, that instrument, the IDFF, Infectious Diseases Finance Facility, was actually the one that we then later used in 2020 to early on make 100 million investment into BioNTech. So I guess what I'm also saying is it's very important to sort of look at the public-private financial landscape and ensure that those public institutions that can actually blend sort of bring in capital grants and blend into that capital and take that higher risk, that they come in. I would not agree with some of the statements that I had heard earlier that market forces alone will solve this. I believe this is actually a case in a lot of those investments where we need patient capital, where we will need very strong policy orientation, mission orientation to really get things going. And I would maybe then the last point I would like to say is on the institute side, the reason I'm very excited to be in the panel today, but generally to get to know as many of you as possible, is one of the new initiatives on the institute is foresight. And everything I've heard today, I believe is for us, foresight would fall into foresight, because the linkage of brain capital and economics, the other issues that have come up, I don't think is well understood in certainly the policy context that we operate in, nor in an institution like EIB. And I hope that with you, we can actually maybe fund research or we would like to support initiatives that allow us to better understand that, because I think we can also be a bridge on the institute side between yourselves and the policy community. And I stop here. Thank you very much.
Thank you, Shiva. This is very important. Also, you mentioned that the EIB has been already by its mandate a sustainable bank, and this is also in practice. But as you know, the social dimension is not yet developed on the ESG matrix. Perhaps the EIB could become also a leader on the social aspect. And this also could be used via the brain capital framework, because in fact, it's really encompassing the human and also healthcare, also education skills and so on and so forth. And we had published a paper, in fact, putting brain capital in the next, or I would say the post-SDG framework at the COP28 in Dubai. And I think this is also one way to push the policy or the global policy debate forward. We can certainly share with you the paper that could really give you an idea on how really to move from sustainability and sustainability matrix into also social matrix, and later on develop the governance ones based on the interaction of both matrix, which is social and sustainability. But thank you very much for your work on this, and for sure we need to enhance awareness and more education on this novel approach, which is in fact quite interesting because it connects two aspects, health policy and also education and social policy. And this is really the missing part of what we need to have this integrated approach. So thank you very much, Shiva. I would like to give the floor to Christian, impact investor in general. So please, what's your view on this? And how do you see the role of the asset management community?
Hi, Rim. Hello, everybody. Good afternoon. My name is Christian Schütz. I head up sustainable investing and ESG at Golding Capital. So who's Golding Capital? Maybe a quick intro. We are a German domiciled asset manager in private markets. We manage 14 billion euros on behalf of our pension, insurance, and other institutional clients. And we do this in private equity, private credit, infrastructure, and impact with a global investment reach. So for us as an impact investor, question really starts by figuring out what impact investing means. We've formulated our answer to that by saying, for us, impact investing is investing in companies that make a significant contribution to mitigating climate change, biodiversity loss, global inequality, and doing this particularly through their products and services offered. So we are at a company focus. We're looking at an opportunity set here. That's our definition. That might not necessarily be everyone else's definition, but this is the one we build on. When I reflected on the brain capital framework and what that includes and what action it leads to, thinking about brain health optimization, then we find actually quite strong overlap across themes that we invest in and what the framework addresses around physical health, around healthy environment, around access to quality services. When we think about our impact strategy, we have a sectoral focus that emphasizes climate technologies on the one hand, which really goes along energy transition and efficiency, circular economy, transport and mobility, but it reaches as far as food and ag tech, where there's a particularly strong relationship between the food system and the effects that it has on physical and planetary health, and also tying this back into the brain capital concept. All those investment opportunities that we see in this climate tech universe, they all have in common that they're leading in innovation in their specific sectors. All those are companies kicking off new ideas, being very innovative, solving societal problems in their own behalf with their own technologies and services, and that puts us pretty squarely in the sort of green brain capital part of the concept, and we invest based on that resource. And the fifth focus area that we have that reaches a bit closer to aspects of quality service and is also more regionally tied to developing markets, in particularly as we focus on inclusive finance, where we do see revolution taking place in developing markets in the form of digital financial services, which also has huge effects both on private individuals and small companies that gain through these types of technology access to cost-effective financial services, but also enabling completely new business models, and we hold many of them. When we look what all these sectors have in common, they share three main characteristics. First of all, it's fast product scalability. Those are ideas that can grow if they hit mass market. They are at or at the verge of being profitable for both manufacturer and the customer. So it's a question of, is there a payoff to be expected also from those who use the products? And the third one is that they tap into very large markets. This is really sort of a growth stage impact investor mindset that we bring here. Investing with that impact focus we also seek to measure what that impact is, and using models such as the theory of change in assessing impact, we currently build on the UN SDGs as well on other more common impact metrics that allow impact to be transported across a portfolio. And what makes this brain capital concept so interesting to me is that this concept in itself reaches further to the core of where it all begins. You mentioned these SDGs already a couple of times in the remarks before me, but when I look at the SDGs, there is also a cascade of SDGs happening. Some are super SDGs that unlock others, and taking this concept further into brain capital, that goes even more to the root of that cascade that one can look at and also think about an investing impact without actually being always necessarily able to invest directly into this unless you go into sort of more the life science area of the investable universe. So that's really building from there on is how we see impact as an interesting avenue in facilitating what a brain capital idea brings to the table in expanding. If you think in economic terms, further down the value chain or upstream the value chain into the root where it all comes from, and there are first order derivatives that translate itself into products and translate itself into companies that are investable, that have strong return potential, and at the end can be a very viable, scalable investment solution that we see an ever increasing demand for, and that's what makes the concept so very interesting.
Thank you, Christian. I turn to Dan. We heard from the four panelists. What is your intake out of this? And we have a little bit of time shortage now, so we need to also close this session.
Yeah, I can keep this short. So I've worked in financial services, building asset management organizations for 25 years. The organization I built managed money for foundations, endowments, sovereign wealth funds, not-for-profit organizations, pension funds, and high net worth. So I can tell you in the 25 years, I've learned three things about the financial services community. The first is that they're highly motivated by money. The second is that they're not great at originating thematics and stories. They like to be fed them. And the third is, if you want to engage their capital, then remember the first two. And I think that the opportunity that this community has is to actually fill that void that was mentioned earlier, where macro storytelling about the structural problems we have with brain health and mental health across society is not investable. It is a socioeconomic policy theory. Hopefully that gets translated into practice. The fundable bits are the things that you do from the bottom up to provide solutions. And what this group needs to do, I think, is collaborate, come together and create those central arguments in a way that really engages with the audience that you want to commit to having impact. For me, I think that the asset owner community, that for me is high net worth, that's pension funds, to some extent it's asset managers, although you need to remember that they are the agents of the pension funds typically, so we'll just do what they're told to make money. they need to have this issue explained to them, and we need the scientists, we need the policy people, we need the people responsible for healthcare and for innovation to explain to that community how they can deploy their capital both to get a financial return and also to have significant impact. And I think that is an enormous opportunity. It's extremely hard to do. I have to say, I would highlight, if you didn't hear the IHME presentation or Kana's presentation from McKinsey, these are massive step forwards, in my opinion, in framing these arguments. The first thing is data and evidence. The second is explaining strategically how we answer the problems. The third is then articulating those to the stakeholders in society who are going to drive impact. I'm very excited about it because I think that those things are rapidly changing and they're underpinned by scientific advances. So I think it's exciting, but I do think we need collaboration and clarity of who we're trying to talk to.
Thank you, Dan. I look at the time, I look at all of you. I'm sorry, I'm not going to give you the possibility to have questions because we don't have time. But for sure, we will have further discussions on this topic. We are still at the beginning. We are trying really to decipher these interactions between nature and brain capital. And I think there is a clear connection. I don't know if we will have the time to see that the financial sector will change the mindset. I don't know. They have to change their mindset pretty fast. And they have to adjust their thinking about risk and return in a complete different way. This will take time. I don't know if we will have all the time of the world. So I look at Shiva, maybe that would be promoted by policy banks like the EIB, and then the market will follow with some sort of guarantees, so to fill the gap. But anyway, we will see how things will evolve. But thank you very much all for this very exciting discussion. And I see that we are discussing this 20 years ago. We didn't. So this is great. So thank you all.
Thank you. Bye.
Thank you.
Thank you. Thank you very much, Rim. And my apologies for having had to put the hat of the naughty timekeeper. But we are really eager to have a conversation at the end of the day. And we know that some of the speakers in the last panel have time constraints as well. I'd like now to invite George Freidenberg to the floor. George, you're the founder and the chairman of the Davos Alzheimer's Collaborative, and you're going to speak to us about the Brain Health Industrial Innovation Strategy. So over to you, George.
Thank you very much, the European Brain Council and Fred and Harris Air for inspiring me to come and to speak. But this is the time of day when everything's been said, but not everyone has said it. So I will try. I'm going to forget my slides other than this one and just tell you a story about how I got involved. I am a patient advocate. I had a grandmother who died of this disease in the late 70s called senility. And of course, she just sat in a closet and did nothing. They didn't think it was a disease. It was just what you got when you got old. A mother who died of what was characterized as Alzheimer's, but actually was Lewy bodies, because no one knew exactly how to detect and distinguish between various forms of dementia. And I now have a brother who's in the late stage, who is actually making his reservations to come to Zurich to go through exit and commit suicide. So this is very personal. And so after a career in business as C-suite at CBS and AOL and Fox, working for Rupert, which was a stimulating experience, but not one I will repeat. I have devoted the rest of my life, starting about 15 years ago, to stopping and ending and preventing this disease. So I started basically as a political organization with a political action committee in the United States. This is a US story, but a patient has a different perspective on this, a sense of urgency, a sense of passion, a sense of all of you guys in government, in industry, in science, and academia need to work together, because You're serving me. I'm your customer, and you better get on the ball. Each of you have a different role, but boy, you ought to understand what your respective roles are and get there. The other power of patience is to convene. This is relative to this, which is basically, I get to call up government, I get to call up business, I get to call up academic scientists, get to call up trialists and say, let's meet. So I started this organization, as I said, back in 2010, when basically $400 million a year in the United States was being invested in Alzheimer's research. Today, it's close to $4 billion a year. $4 billion a year. So resources being applied. Another big problem, clinical trials. So they're slow, they're big, it takes a long time to recruit. Companies set up a clinical trial network, conduct their trial, and then tear it down. So we said, that's stupid. Why don't we create a patient-led platform for clinical trials for everybody in the Alzheimer's space? Because we can innovate there by getting, in the United States now, 100 trial sites, in Europe, 50 trial sites, conduct transatlantic trials now 6 to 9 months faster than otherwise is being done. And we're innovating in a variety of ways because the platform can innovate for all the companies in which no one company is willing to invest the innovation. So we have a single institutional review board for patient safety. We have a single roster of all of the raters that are involved. This is nuts and bolts stuff. This is pragmatic stuff of how to actually get faster clinical trials. And now it is, that platform is innovating on biomarkers because biomarkers are critical to identifying the right patients for participations in clinical trials. Practical stuff. So clinical trials was mentioned. One of the second things we did was to set up a corporate roundtable. All of the biopharmaceutical companies, biotechs and pharmaceutical companies, with a therapeutic intervention in this space are in a single organization, a corporate roundtable. Why is that? Because patients want to know what corporations need in order to get more drugs to us faster. So that has led us to a whole system of how to prepare health systems for actually getting drugs to us and prescribing to us and detecting our disease better. So the other thing that's driven by patients is that we want not only everybody to work together, but we have to get every element of that value chain so that the basic research is there, that the clinical trial and application research is there, that in fact regulatory policy is favorable to approving a drug based upon biomarkers and not about clinical benefit. Getting payers to pay for those drugs at that stage of the drug development, and getting health systems to actually be prepared to deliver it to us. So we work at every element of that value chain. We work in the United States, we do that. Then we got called about 3 years ago by Klaus Schwab and said, I think Alzheimer's is now a global health problem of the size and dementia of any infectious disease. I incubated here Gavi, I incubated CEPI. I've started a $700 million enterprises to basically try and tackle this at a global level, because I want to make sure, as we're developing solutions for Alzheimer's, that those solutions are developed for everybody and not just us white Caucasians in Europe and the United States. So now the Davos Alzheimer's Collaborative is engaged now as a very, very early stage nonprofit to do precisely that. So how do we do that? We work with cohorts that have been created around the world for malaria, for HIV, for chronic diseases, cardiometabolic problems, and say, okay, we're going to invest in you to add brain-related data to your work. Blood for genetics, biomarkers, and biomarkers of disease, both aging and of Alzheimer's. We're going to take digital cognitive assessments, stimulating now a digital cognitive assessment industry to basically detect this disease earlier so that we can be able to deliver to patients the therapeutic interventions that come through the pipeline much earlier in the course of the disease. So if you're slowing down the disease or stopping it, you're not stopping it in midstream, you're stopping it upstream, to the point about earlier comment. So this is a passion project. We now invest in vans in Armenia for community health workers to go out into the field to take blood draws and to do digital cognitive assessments. We have a major partnership now with Worldwide Fingers. Many of you may know that, out of the Karolinska Institute, that basically is now working in 62 countries on the lifestyle changes associated with better brain health during the course of your life. So what we have seen is that the prevention angle, the treatment, once you get symptoms, is not when you should attack Alzheimer's. We have to prevent it. On the therapeutic side, that means our working group on Alzheimer's vaccine, which now has 8 companies in it and 4 regulators all sitting at the same table saying, what's the scientific evidence for the effectiveness and safety of a vaccine? That is now in progress. The goal is to get a vaccine on market by 2030. So on the prevention side, in the sense of brain health, how do you get at cardiometabolic diseases in midlife? And how do you get at lifestyle changes in midlife? So we're now going to governments, starting with Kenya, but also working in Latin America, to say, have a national plan that basically says, let's intervene with primary care, whatever it's community health workers in many parts of the world, so that they can basically say, here's the cardiometabolic intervention that will prevent diabetes, that will prevent hypertension, that will prevent obesity, and here is a brain health score for how you should assess the quality of your lifestyle behavior changes. Big problem, but nevertheless, it is a plan that is practical and real and can be implemented today. And we're getting strong positive response from the Pan American Health Organization, the African Health Organization, and others to say, okay, where do we pilot these national plans in the world? Now, if you begin to get at cardiometabolic disease, if you begin to get at life course efforts in lifestyle changes, you're approaching from a completely different angle what all of you have been talking about. And it's a different angle, it's a different direction, but we have been driven in the United States in terms of where we've gone with our funding because of the costs to the American government of taking care of people with this disease. And the estimate was that it's going to take us it's going to take, as I think by 2040, early 2040s, the cost to the American government of Alzheimer's alone exceeds the Defense Department budget estimated at the time. So Congress didn't know what, $1 trillion was, but when we said, is it bigger than the Defense Department? They began to pay attention. So I would say the driver of change, at least in our advocacy work, has been the cost of the disease. But we have to then think about how to deliver solutions to the global south, to places that can't afford this. And that is vaccines. Folks, when I go to global health, World Health Summits, they only talk about vaccines. They don't know how to deliver anything else at a primary care level. Not enough neurologists in the world to solve my problem. There are not enough PET scans in the world to take imaging. So I have to drive down blood tests and digital cognitive assessments. And the way I do that with the Gates Foundation basically is accumulate all that evidence in a common data set that's available to the world so that the intellectual capital of the global south is engaged as well as the global capital of the north. But none of this conversation really has gotten at what the problem of the global south is. You can't deliver interventions. It's very difficult to deliver all of what we've been talking about here. But I will tell you also that the World Bank has been saying, we may finance, if you come up with plans, that in fact you can deliver this at a primary care level. We may be prepared to cover the cost of training of that workforce. But boy, you have to have a very practical, very concrete, very precise way of doing that. Now, for industry, industry supports us because of the health system change. They want to see us be able to deliver at primary care levels the ability to prescribe their medicines. Foundations support us because of, in fact, our commitment to the global south. But we have a real problem with governments. The United States government is only investing, basically it's $4 billion a year in the United States academic institutions. It invests the rest of the world. But our global health authorization is infectious disease. Infectious disease. The next pandemic, how do we can do surveillance for the next outbreak? How do we basically set in place all these institutional and infrastructure for infectious disease? And I'm saying, do that infrastructure for chronic diseases of aging, because we need that early surveillance of the risk factors for all of that. And then we can drive life course efforts around things that for my community and my passion is Alzheimer's, but for everyone else will serve a lot of other courses. So I thank you for being so generous and inviting me, hearing my story. It's very personal, but it's not the same thing you've heard all day. So I just thought I'd pass that on.
Thanks a million, George. And actually, your experience is extremely valuable, not only in making the case for Alzheimer's and brain health, but also to pick up your words, not only come up with the magnitude of the problem and the cost, but also to try and bring up solutions to policymakers. So we are now moving to our last panel, and I think it's actually a perfect transition for concluding panel, once again moderated by Pavel. This panel is going to actually deal with the pathways forward for brain capital. And Pavel, you'll be surrounded by Harris, Michael, and we have, I think, Shiva again online. So over to you.
That's right. Thank you very much, Fred. So we need to do a little bit of a sprint because, yes, this is the last session and everybody has flights to catch. And also Shiva has to leave before 5 o'clock. And I promised to her to let her go. She has been very generous with her time with us today. So pathways forward for brain capital, a deliberately spacious title for this last session because we need some brainstorming here about the strategy of how to take this collective wisdom and energy forward. And for me, it's a fourfold question. First of all, it's the question of conceptualization and scope. Namely, do we capture the phenomenon in the correct fashion? Meaning, is brain capital relevant to all the issues that we want to address? How does it differ also from the previous concepts that have come in the past, like human capital, right, which is about knowledge and skills? I know the answer, but is it clear to everybody who works with us? Secondly, it's the question of what George, who is just leaving, called the practical stuff, namely, how do we implement the brain capital agenda in concrete terms? And do we have, the ground covered in a sufficient fashion? Thirdly, it's the question of sequence, namely, do we use the right opportunities in order to advance this agenda? And I think we're using a lot of opportunities. Harris had this slide at the beginning about what is going to happen this year. All the G7s, G20s, UNs, and all have you, and I put the emphasis on the EU programmatic period that we are in the middle of right now. And finally, what are the actors that needs to be involved, and do we have everybody who needs to be part of the conversation, or should we have someone else? So Shiva, I would like to go first to you because you are. I would say also a passionate endorser of the brain capital approach, and you are now working, with us to shape the agenda. And I would like to start with a question: how do you see the possibilities both within the current also funding framework in the EU, so the multi-annual financial perspective? That gives you the resources to work with in order to invest in brain capital related issues, and how do you see potentially the prospect also in the future period of funding in the EU, and how can the EIB also mobilize more private capital for the brain economy?
Thank you very much, Pavel. Now, this is obviously a big topic, and I try to perhaps zoom in on some of the maybe the key points, but I would very much hope that we can continue the conversation with those in the room and online that we should actually maybe have a more concrete follow-up with. I think from an when it comes to big financial institutions like the EIB, my take right now is we are already, I think one has to be careful not to right now make this sound that this is all so novel and so new that it requires completely changing everything, because I think that would be quite terrifying to those who are. And I think the psychology in a lot of also the public sector institutions or the MDBs, multilateral development banks, is that there are so many competing priorities between climate, pandemic, health, climate, and so on. If you add another element that seems like completely, again, being very pressing, it sometimes, seems that it's paralyzing, and perhaps even people may not have the bandwidth, I guess, maybe the brain capital to really capture it. So therefore, I believe in the current financial framework, the key is to actually bring in a brain lens. I was just in the last few days trying to get myself better informed of the sort of investments that we have made over the last few years in our various portfolios. When I say portfolios, in our various financial instruments that we have in brain-related, let's say companies, biotechs. And there is quite a lot. I mean, of course, we don't go into the market and say, hey, we want to now invest in brain capital, but deep technology companies, biotech companies that are either financed through the EIC, the European Innovation Council, which is the EU's flagship, product, giving grants and equity in early stage companies, as well as our venture debt product as part of the big stimulus program of the EU called InvestEU. Those instruments already are actively investing in very innovative companies that also, that are very much investing in cure, in prevention. I mean, I don't know about vaccines now for Alzheimer's. I mean, that may seem not yet on our horizon, but certainly in a number of also med technology companies like InBrains that we recently invested in for implants in brain. So there is activity going on, and the question therefore is, how do we scale it up? How do we bring more focus through a higher awareness? As your colleague, as the gentleman earlier said, banks are not very good at originating at thematics. I would say that may also apply to the EIB. On the other hand, the EIB has to actually go through policy orientations and thematics. So I think we, if anything, should find a way to make this more digestible for our own bankers who have now gotten themselves to understand what it is to invest in circular economy, blue economy, and hopefully at some stage into nature-based solutions, to also understand what it is to now invest in projects that also have a brain component. I think the easiest one is, of course, for us is the innovative companies that invest usually in cure or preventive medicine that where there's also a huge market. And those companies actually very often they are, unlike infectious diseases. I think one of the other panelists was saying it. I see the market demand dimension very different. So I mean, there is a much better financial return case in those investments than we had in TB vaccine or AIDS vaccine or some of the more typical infectious diseases. So we need to leverage that. We need to certainly ensure that we have that focus. I would also say that we need to make sure that we sensibilize certainly the EIB, but also other funders of the public sector to this all the prevention discussions that came in, where we are right now, for instance, actively working with governments around the world on strengthening health systems when it comes to pandemics. I think that obviously the next, and we have that, of course, now for antibiotics, and the next big thing is brain. So, I mean, there is, of course, the issue is how do you bring this conversation in a rather crowded set of key health challenges without you know, again, being crowded out because there's so many other priorities. And I believe the gentleman earlier, you know, referring to the US defense budget being, I mean, we need to get the numbers out. I think this is probably what I believe we haven't done enough, also not in Europe. So therefore, for the current health system, I would say it's for the current MFF, let's use all the instruments that we have and ensure that through the policy dialogues, the EIB and the Commission have a much better understanding about the importance of it from a policy dimension, and then start paving the way what that would mean in the next framework. Instead of trying to now be too innovative and think that we need to create a completely new instrument, because I think we would lose people, unfortunately, because of so many other pressing priorities. Sorry for having maybe given a too long of an answer.
Great, thank you very much, Shiva. So as you pointed out, there is a lot of investment going into the brain economy, which perhaps we could do more to document and to sort of have more evidence of. With respect to the future, the question that arises has to do with whether or not more directionality would be needed and could be afforded. Meaning, can we do more clustering of investment so that there is sort of a critical mass emerging in a given area? Because I mean, there is EU spending and EU investment in many different fields, but sometimes it's small and not sufficiently impactful. So how can this be changed in terms of getting more directionality in the future? I now would like to turn to Michael, who is the global head of access at Roche, with a question about, first of all, I mean, from your perspective at Roche, what it is that you would expect from the brain capital approach. I mean, you are, you know, a leading global pharma company, and then you hear this very ambitious, overarching concept, which is about centrality of the brain in many different areas. So what it is that you would expect, and what it is that you would be prepared to contribute also to advancing this approach.
So thank you. And first, let me start with a disclosure. I'm not a brain health expert at all. And actually, my brain health is a little bit down at the moment after hearing all the brilliant commenters here. But what I'm an expert in is I'm a behavioral economist. I worked with politicians for 27 years, and my job is actually not to sell drugs. My job is to convince policymakers that health is an investment and what constitutes a return on investment. And with that, actually, I loved what you said, that I'm going to contradict you in the next second, but it comes from a place of love. I think doing more of what we're doing now, I think incremental improvement investment are not going to get us where we need to go, because the numbers are frightening and mind-blowing and staggering. So if I would look at it is, there's a good old book from the 80s, Michael Porter, who looked at the competitive advantage of nations. And a key element of the competitive advantage of nations is actually the input factor, which is the human beings and the brains that we're having in society. And post-COVID, and I love, by the way, and deep respect what you said is, if you look post-COVID, what is on the priority of nations, it's not health. For those who are with war, it's defense, but for most of them, it's wealth and economic growth. Because if you would look at the past 100 years, health does not help you win elections. What helps you win election is a low inflation and a good economy. And I like actually very much sort of like this concept of brain capital, if you could translate it not only into the cost to society, but if you could translate it as what is the return for society by investing in brain capital? If you could find a way to demonstrate with certain interventions in improving brain health, I'm going to help you grow your economy by 2%. And there are methodologies out there. And this is actually where Roche is coming from. And very simple, like we are this 125-year-old Swiss company, our guys, family, they founded the WWF. So sustainability is really in our DNA. If you're not addressing brain health, we are not going to achieve SDG 1. There will still be poverty, not the 2 with the hunger, and for sure not SDG number 3. And there's no way we're going to reach any of those 2030. So for me, in my logic, but maybe I'm too naive, in my logic is actually investing in brain health is first of all a key to drive economic growth, which is an argument that lands, if you can prove it with data, lands actually quite well with economists. And at the same time, it's going to be a key contributor to SDG. And we have a vital interest because guess what? Without having resilient and sustainable healthcare system, I don't have a market.
And Michael, if I could press you a little bit on what you said at the very beginning, namely that incremental won't suffice. So what do you mean exactly by non-incremental then? I mean, what is the
So
type of...
You wanted to have a moonshot idea, right?
Yes.
Technically, one could argue we could make a ranking, and I think the brain index is starting to doing that. We could measure the competitiveness of nations by making brain capital an index. Because if I'm now in my early 20s, where would I go to study? Or where would I want that my children go to university? I'd rather send them to an economy where brain health is the key focus areas. Or you could even say, if you're one of the World Banks or those big donors and money givers is, that I say, if you invest in brain health, you get my money for a lower interest rate. I mean, one could think about, because I firmly believe, as much as I love thinking about changing mindsets, sometimes changing incentives is faster.
Right, wonderful. That's a very inspiring vision. I would add to this that obviously when you look at the wealth of nations, what matters very much is also the institutional setting. Namely, I mean, the differences in Europe, which you observe in productivity between the different regions, North, South, Central and Eastern Europe catching up very consistently. I mean, they have to do with the institutional ecosystem for innovation, right? So you can have the physical capital, you can have the human capital, you can even have brain capital, and then what matters is whether the ecosystem is sufficiently helpful for you to bring these innovations to the market. Maybe we should also include that in the brain capital approach, namely the agility of the institutions themselves. But Harris, can you tell us when you think about 2024 and the brain capital agenda, as you pointed out at the beginning, there is clearly more emphasis on the brain economy per se. Can you deconstruct that a little bit to us, for us? Is it related to where you see technological change going and how the brain capital agenda should react to it? What's behind it, and how does it sort of differ to the earlier periods in the brain capital history?
Yes, thank you very much for that question, and thank you, Mark, for your remarks, and to Shiva as well. I mean, it's been a remarkable day and a lot of reflecting that I need to do to unpack all of what we've talked about. The brain economy construct, transitioning from our current economy to a brain economy which has more investment in neuroscience research, like George was talking about with Alzheimer's disease, more state-backed investment in risk capital funds, venture capital funds, startups. This was the idea that we had for 2024 to offer the biggest canvas upon which all of us could paint something on. So it's trying to really go big, something that if we move to a brain economy, we will interest the G7 and their interest in economic security, because we will be able to demonstrate that the current economy is reducing our productivity. And so what can we do to improve productivity with our skills and health? We're trying to afford in the brain economy latitude to talk about AI. AI is good for health product development. AI is good for some of our jobs. AI is going to be very destructive for many jobs, and it creates a lot of fear. It also is optimizing disinformation volume, which is a huge risk. So anyway, you get the point. So we're trying really with the brain economy transition to get ourselves into these big international fora and national fora, so G7, G20, COP, UN General Assembly, and to go speak to Congress, also with Facundo Manes, who's one of our colleagues, who's a neurologist and a congressman in Argentina. We want to go on a parliamentary tour around the world, working with his access as an Argentine congressman to speak to parliaments around the world about this, and ultimately get to an interparliamentary brain capital task force or brain economy task force. So we have big ambitions, but as has been pointed out today, just this kind of high level theoretical systems economy change is not sufficient, right? It's just one piece of the puzzle. We need specific projects that we want to get funded. So, so it's great to have George talk about DAC. We have discussions thinking about, corporate venture and also, brain health plans, etc. So I think the key takeaway for me is that we have lots of momentum. We have an opportunity to do some big stuff. We need to, have the big platforms and have the big grand narrative, but get very precise about projects that we can do. So if we don't have precision from now on, we risk losing the momentum that we've built and the stakeholders that we have interested.
Super. Thank you very much. Shiva, before you have to go, which is in 5 minutes, could you tell us a little bit more about these plans regarding the foresight work of the EIB Institute, and to what extent you think brain economy and brain capital could be one of the areas of focus in this foresight work? So what approach exactly are you thinking of adopting, and can brain capital be part of it?
Absolutely. I mean, so the approach is rather broad, and I mean, of bringing in foresight into the institute, meaning really trying to use our various activities with the academic think tanks, all the sort of various counterparts that the institute works with, to really future-proof the EIB's investment approach and understanding. So therefore, brain capital, to me, given that it is such a really important and as everybody's saying, sort of fundamental issue, I would like to bring that also in the context of economic security, which I know, Pavel, is another important topic for one of the many hats that you're wearing. And I think concretely, what I would hope is to actually engage with those of you in the audience and in this community who can, on the one hand, potentially help us to do some what we call business-related research. So we would fund some activity, some research activity, really to get maybe the narrative. As I think Harris was saying, there's the very concrete investment proposals, but also a narrative that is understandable by the financial community. And let's start by EIB already. I think that would already be quite a long way, a big achievement. So doing that, helping us better understand the links. And I think a lot of the data that was presented today would actually help to understand the link on the costs and the cost savings by investing in a brain, in a healthy brain economy. So we, and do so also, we would also like to perhaps organize fora where we bring key people from obviously the EIB, but also the financial community, the policymakers, sort of play a bit the convening role, or partner up with those who have that convening role, like yourselves, and support this this exchange, because I really believe that there is, what you guys are discussing is not yet, has not landed, certainly in our bank and in probably many other financial institutions. So that would certainly be one, this would be certainly something I'd like to very much follow up with you concretely on. So the research and the convening with the relevant parties. And the gender lens, I should add, I loved Antonella's comment. I was not aware of a lot of things she said. Let's really make sure that we bring in the gender lens.
Excellent. Thank you so much, Shiva. So we now have, I think, a very clear picture what you are looking at, sort of the impact in terms of cost savings, in terms of remodeling of the economy as well. I mean, clearly the green and digital transition is is ongoing, but we also need to look beyond, and the brain economy is part of that answer, and hence the linkage with foresight, which I think resonated very strongly with us today. So thanks so much for joining, Shiva. We know you have to go. Thanks a lot. And
thank you very much
let
again.
me ask if there are any last comments or questions. George, please.
Two comments. That sort of my argument that cost will drive some change here. First, the chronic diseases of aging costs are now overwhelming most health systems in the world. S&P is now looking at sovereign debt rating quality based upon a country's plans to control chronic disease of aging costs. That's going to lead governments largely to price control rather than invest in the solution. So I'm going to suggest to you that, in fact, cost is going to be a big driver through the financial system, and not just because I have a Defense Department argument. But Harris made one other point, which I should have made, and that is we're working with the business community now on what they've asked us to do for a brain health index or a brain health scorecard of their company. Because we know that one of the great drivers of health is purpose and meaning in life. And so how do companies do that? What is the tactic they ought to be using to generate purpose and meaning in their employees? Car companies should be taking care of and thinking about the cobalt miners in Congo. But just think about what that means. So if you could get companies to broadly adopt or even partially adopt a brain health index for their employees, and then, as Harris has suggested to me, then get an ETF that invests in the companies that actually do better job on their brain score. Why? Because we can associate better brain health in the employee base with better financial performance and better competitive performance. So, in fact, we can then get a financial instrument around brain health.
10 seconds to respond.
Of course, I will just have a look if there are more comments or questions, please. So let's take them together in this final wrap-up round that we will have.
Thank you. As I mentioned already before, that this has been a great conference, and we have really been talking about the issue itself. But I have a question to us all. This is more or less, anyway, a meeting of believers. Don't we need next time, teachers, sportsmen, private more private investors and other industries to come step in and discuss with us, because more or less we have a joint understanding when we are talking about brain health and this kind of issue. Even from my perspective, we should focus more on real brain health, because we are talking about brain ill health quite much anyway. But I think that we need all sectors from our societies. And now during this day we had talking about them, but they have been not involved. Maybe next time.
Super. So the question, who is in the room and who should be part of the conversation? So we have one more comment or question.
Yes, I just wanted to say thank you very much for this comment. I agree. And I remember you gave a great presentation at an EFNA meeting in Dublin, also to show what Finland has done. And we had at least the patient community present. But you're right, the educational system, teachers, people that are really out there. We spoke a lot about the youth and adolescents that are really out there dealing with them, because we have that agreed interest here. We have to some extent shared understanding. I would hope we have 100% shared understanding. But at least for me, I listened to everything today and I'm thinking, wow, I knew it's multidimensional, but you are again reminded from how many angles, how many things should be done, how many lenses people apply when looking at this. How do we get this together and what's next? But I think that's the big $1 million question, right?
Okay, brilliant. Thank you so much. Having a final look around, it's pathways forward for brain capital. If anyone has another ingenious idea which has not been mentioned, Fred.
Well, actually, it's not an idea, but I would restrain to one quick question to you, Michael, just because of the context in which we are living in. So and I'm picking your economist brain with my question. We had post-COVID a huge recovery plan with billions of euros being poured by governments in the US and in Europe mainly to try and reboost the economy. As you said, economy and recovery was the #1 kind of priority. There are no discussions as to going back to a kind of more budgetary orthodoxy in public spending, combined with geopolitical instability that we mentioned this morning. It's very likely, and that's the discussions that we are now having. It's a pity Shiva could not be with us, but in the context of the financial framework at EU level, to go back to the Stability Pact. That means major restrictions in public spending, and that's likely to mean austerity measures being upon us in the course of the next 6, 12, maybe 18 months. How do you see that? What's your appraisal? Do you think that's going to be the case? And how is that going to impact the discussions we are having today? Because whether or not we change the narrative of saying healthcare spending is not a cost, it's an investment, is meaningless, because if there is no penny to invest, there is no penny to invest, whatever we call it. So
let me just have the final look. I think these are the essential issues. So the economic one has sort of grown to be central in this concluding round, namely how does the cost, the price tag translate into the willingness of governments to invest versus control the prices? And I mean, will we have enough money? Especially given all the other priorities that we need to keep in mind.
So I have a practical and a philosophical answer here. So the practical is austerity measures are already happening, and they're happening not only within countries. We do know that the big donors, and that dramatically impacts, unfortunately, the global south, they have cut down on foreign aid for healthcare, which makes it even harder for those countries. So there's really, in certain geographies, a serious risk to making progress. And the interesting question that I'm then getting about, we don't having the money. So we can afford that we lose trillions per year, right? I don't know. So my more philosophical question is, or what's currently happening, and you mentioned the G7 and the G20, and I'm currently involved in preparing the agenda for India next year, is actually, I don't speak anymore to a health minister, because he's just he or she's on the receiving end. I'm speaking to the finance minister, to the minister for education, the minister who has an interest in the more and more those with the tech industry and I find them actually more receptive. Still, just building on what all you said is, I still need to have the data, and I still make the case. But I think we need to think differently about sort of like our own, sort of like our external stakeholder matrix and decision maker matrix, and where to make the case.
Wonderful. Thank you so much. Harris, the last words, taking into account the 2 other points that were made. So the brain health scorecard in companies, I see that more also as sort of taking the brain capital agenda into the world of business in a different fashion. So not just through the brain health angle, but to the core of how these companies function and operate. And then the question of who are the actors and how can the brain capital approach also cater for the needs of the different audiences.
Yes. Well, I think on the brain health business collaborative, I mean, I think George has explained it well. Google it, check it out, and we need to engage in that collaborative, engage in the discussions. Kelly O'Brien, who leads it for George, would be happy to have a conversation with anyone to explain the different tools and instruments that are being developed. So I think it's an extremely meritorious project. We've talked about mental health in the workplace for a long time. Now we talk about brain health in the workplace. So what does that mean? What are the instruments and tools? And it's collaborative platform to develop. So anyway, check it out. On the topic of Micah's question about stakeholders, one key stakeholder that is not in the room is the sovereign wealth funds and the public pension funds and the asset managers and the asset advisors. And so with Dan Mannix, we've been thinking about how do we convene them. So if anyone has thoughts about this, we want to start having conversations with these people that manage trillions of dollars of global economic funds. We've been talking with Bill about it, but how do we structure this? Maybe something, Michael, this is, you can help us think this through. What is the dialogue that we need to have to start opening their hearts and minds, and then also their frontal sort of analytic sort of interest in return on investment as well. So because we can engage the Blackstones and the BlackRocks of the world, but what are we going to talk to them about, and how are we going to channel their money when they say, okay, I get it, what do we want to give to? So the opportunity is ours. We just need to be very, very delicate in the next couple of months to finesse engaging those high finance stakeholders.
Thank you. So I think it's going to be a great year for Brain Capital Alliance, for the Brain Capital approach. Going back to my 4 points from the beginning, when it comes to the concept and the scope, I think the concept gets increasing traction. It resonates with more and more people, and I think it actually answers the demands of the day with the technological acceleration, especially in minds. When it comes to the sequence and the timeline, as we heard earlier, 70% of the global population will go to vote. So one has to be very focused on where and how to be impactful in this year of elections and also global transition. George's question of the practical stuff, I think we have reviewed quite a number of very tangible projects today. The challenge is always how to keep everybody on the same wavelength and connected. The more projects develop, but I'm sure this will be manageable. And finally, the question of the different actors who needs to be part of the conversation. That's something that I believe we always have to keep in mind and ask ourselves every time we meet, haven't we forgotten somebody who is really essential to the discussion? But with that in mind, I think we're off to a great start in 2024. I think we have eaten up the point that is called audience discussion in the program, but if Fred forgives us, we will
No,
now
I won't
hand over to him. But big thanks to the panelists, Shiva, Mikhail, and Harris for joining me on stage. Thank you.
Thank you, folks. Well, actually, it's not me having to forgive you, Pavel. It's rather our audience and those still in the audience at this rather late time in the day. We are really getting close to the end of today's discussion. But before that, I committed to opening the floor about your crazy ideas. So I just hope that you made your homework and that you've got something scribbled on the paper. But we can't make it, let's say, that long after the end time, but I'm just eager to leave at least a couple of minutes. If any one of you had an idea to contribute on the basis of Kana's presentation earlier on this afternoon.
Or you can email your ideas, or we can talk about it over a glass of wine.
Yeah, do we need to open a box of ideas online, or do we need okay, you're suggesting a bit of alcohol to nurture the discussion. Okay, that's another point of view. Anyone wishing to comment? Yes, Simona. Oh, great.
Hi, thank you. Thank you very much. I was patiently listening, and this is a topic that I'm very passionate about and that I've spent quite a bit of time on. And a couple of things that have resonated with me from everybody who was talking here, there's such a complexity, right, on this, and one could go so broad. It feels like I don't know if you've ever done the dishes, and when you come home and you have this kitchen full of dishes, you just want to run away, right? So this is how it can feel unless you can break it down. And I think somebody said breaking it down and make it specific earlier. I think it was Mark, I think it was you when you were on the panel. And I think by breaking it down, one could think about what can you have? Can you have an impact in a short term, midterm, and a long term? And you will have different goals within those boxes, so to speak. And in a short term, taking into account the cycles it takes to, for example, to develop a biologic or, you know, to create a system where prevention is possible. Those are mid and long-term things. But then there are some short-term things that one could do. And I'm looking at Bill here with, the discussion that we had with George earlier, and it builds on what Michael was saying. So for example, if you know that 80% of the cost currently for Alzheimer's and dementia is in nursing home spent around the world, it's a big number, right? We're talking trillions. Wouldn't you be willing to invest to reduce that cost for the society? And then you could potentially capture some value for yourself as an investor, but also give some value back to the society. So, you know, there are some things that one could do. I know you have, Pavel, you have some of the digital solutions on that, but being specific on what are the cost drivers in a short term could really help create some of that movement so that the problem and complexity doesn't seem so far away and so big. Thank you.
Thank you, Simona. And I think it resonates also with Michael's comment earlier, is like showing the data and the right metrics on the worth of those investments. Any last comment, George?
There's a very famous conversation where Jonas Salk was told that we needed huge investments in the leg brace and iron lung manufacturing industry because of the growth of the prevalence of polio. And it was a big opportunity in business. And he said, no, we need a cure. Now, if you look at the prevalence of chronic diseases, we just saw a $500 million deal by Novo Nordisk with one of the flagship companies on a vaccine for diabetes. We see now Moderna and BioNTech are investing in vaccines for cancer. I'm suggesting that the investment here to solve the problem of nursing homes is not to invest in more nursing homes or better nursing care. It is to cure these diseases.
All right. Okay. So that's definitely the sign that this conversation needs to continue. And I'll probably now bring the meeting to a formal close as we are beyond our end time. And I'd like to thank, all of you for contributing so actively, first and foremost, because you made it possible, and it's really with your input that we are able to build this type of dialogue. It's also for us, I would say as EBC, but also speaking on behalf of Harris Brain Capital Alliance, Baker Institute, and other partners, a new step in our journey around brain science, brain research, brain innovation, brain capital, and a key milestone because it emphasized the need, but also the potential for this collaborative exercise. And as far as I'm concerned, personally, I was encouraged by the concrete examples that were brought forward. I think that, when it comes to the public-private partnerships, the National Brain Plan, the call to action for European Brain Plan, working on economic and societal inequities, health determinants, increased support in funding, all of that is clearly emphasizing the key momentum we are in for action. But also because, as we rightly said, inaction hurts. And we have this collective responsibility to take this forward, not only towards society, but also on the basis of personal testimonies we heard today, towards families and friends, because we are convinced this is so important. But as I was encouraging you to be in this last session, let's be bold and ambitious. The stakes are high for economy, for society, for democracy, for the future. So you are warmly invited to be in touch with us. We have 4 dates as EBC that we would like you to have penciled in your diary. The Brain Awareness Week event in Brussels on the 7th of March, the Academy of our National Brain Councils on the 9th of May, the Brain Innovation Days on the 13th and 14th of November in Brussels, but very, very, very importantly, the General Assembly of the UN in New York, mid-September, where we are repeating our Brain Health and Research and Brain Capital Day in the context of the Science Summit and Summit of the Future. So please be in touch if you'd like to collaborate with us and be a partner in that endeavor. And once again, warm words of thanks for this contribution today, and all thanks to Roche for helping us putting all of that together, and see you on that next occasion. Thank you.